about, um, first, let me introduce myself. My name's Lori Galbreath. I am the Tennessee SHIP Quality Assurance and Program Development Coordinator for the state. I make sure everybody's kind of doing the right thing and trying to make sure that we're going toward these goals and are doing everything toward our performance measures to make sure everything that we're doing the right thing. We're heading in the right direction. So a little bit about performance measures. You know, we are a grant-based program, as we learned day before yesterday. So we do have some things that we're kind of graded on. So I just want to go through some of the things that count and some of the things that don't count. So when you guys are volunteering for us, you know what you're doing and what you're doing counts. So we want to make sure everybody is kind of on the same page and we all know what we're supposed to be doing. So without further ado, we'll go on. So the SHIP performance measures, we have two different grants. We have the SHIP grant, and then we also have the MIPA grant. The SHIP grant is our basic grant. That's the one we all operate off of. It focuses on enrollment contacts and outreach to everybody we talk to. So pretty much everybody we talk to can count toward our SHIP as long as we're marking the correct things on our client contact forms. The MIPA grant that we'll go over in just a little bit focuses more on the LIS MSP part of it. So as far as focusing on low income, reaching those hard to reach populations, and we'll go over that as well. So you should have a good firm understanding of what our performance measures are, what's expected. So performance measure 1, these are our total client contacts. That is everybody that we talk to. As long as you are getting their zip code and writing down how long you've talked to them and what you talked to them about, we count that as a client contact if you have one-on-one contact with them. Whether it's over the phone, if it's in person, if it's via email, there's several different ways that it can count. We'll go over that in just a second. Our PM2,
Lori,
yes.
One quick thing. It's kind of not in the full screen view. It's kind of in that presenter view right now. Do you know if you could get that to be that full screen? Possibly if you go up to sharing, it might be a different screen altogether for the full screen.
Okay, hold on. Let me see if I can. Let me go stop, and then, okay. So, yeah, I was sharing the wrong, I'm on 2 different screens. I was sharing the wrong one, so sorry about that. So our PM2 is our outreach contacts. That is our, the people that we've talked to through presentations. If you go to a health fair at a booth, or if you go to a county fair, any of the events that we go to. Also our enrollment events, when we do enrollment events at either, senior centers, several different, any events that we go to, that's how our outreach. It's also presentations that you do by WebEx. So if you do a webinar and you have people that you are presenting to, those presentations count as well. I know we've kind of had to modify our outreach, kind of the way we do things this past year and even this year. So we do count those WebExes and Zooms and all of those that you guys are doing. PM3 is our populations under age 65. So this is our disabled population. That is one of our performance measures, and that's why we try to reach out. If you are talking to someone who is on SSDI, we definitely want to mark the correct things, and we'll go over those things in just a second. PM4 is our hard-to-reach clients. These are our low-income, rural, non-native English-speaking contacts. These are going to be there are harder to reach populations, but we still have to do what we can to reach them. There are ways that we have to reach out to our non-English speaking clients, and just we'll go over that in just a minute, but this is an important this is probably one of the hardest ones that we have to reach, because it's really hard to get out in rural areas. They might not have as many events. They may not have, the facilities to have, as far as enrollment events and things like that. So it is a really hard, it is hard to reach these clients. So for the PM5, that is our unduplicated enrollment contacts. So this is going to be based on a list of topics that we have, and we'll go over the 18 topics in just a few minutes, but it's pretty much anybody that you've talked to. If you mark the correct things on in either stars or on the contact form, then it will count as an enrollment contact. Usually PM5 mirrors PM1, so it goes hand in hand. So, but let's get into them in more depth. So. All right, so start with PM1, our client contacts. This is going to be all of our contact forms, all of our additional beneficiary sessions. So if you have a client that you've talked to more than once and you've put in a contact for them in stars, and you've talked to them again and you go in and put in an additional session, all of those count toward this PM1 client contact number. Like I said, it's in person, any contact, telephone, email, postal mail, web-based. There are some things, however, that don't count. It's not, if you call someone and you leave a message, that does not count because you did not have that contact with the person. If you call to just schedule an appointment with them, that does not count unless you've done some, you call to schedule the appointment, but then they have questions. And you answer those questions, then that would count as a contact. So, but just to schedule an appointment, maybe you have maybe front desk staff that's helping, or maybe you're a volunteer that is helping to schedule appointments for enrollment events during AEP. Those will not count unless you've done some type of education on the phone with them. Mass emails, just like doing cold calls, they do not count because there's no way to track if someone's read them, if they just went to their spam folders. There's no way of knowing that they have read that. Also, because there's PM2 and your client contacts that are based on outreach, the people that you talk to through public events, unless you've had some type of one-on-one conversation, maybe they pulled you to the side and asked a question. I always like to keep a little notepad that I can write down. I didn't have to get their name. I just, I usually try to kind of make a note of, some of their demographics, what race they are, their gender, their age, if they were above 65, under 65. I just kind of would jot that down, and kind of some of the topics that I would talk to them about, and then that specific person would count as a client contact. But if you were just going through and maybe you have people coming and picking up brochures and things like that, what I would try to do is, if I'm at an event, if I have brochures out on the table, as they are picking up brochures, or maybe if they're signing in for like a door prize or something like that, they have to get something signed. I would do a little 30-second, 5-second spiel about SHIP so it would count. Or I would offer them and tell them about LIS or MSP. So just making sure that you're talking to them, talking to people, that would make it count for a PM2. But on general, if you go to, say, a county fair or something like that, every single one of the people there are not going to count toward your PM1s. So for outreach, this is going to be the people, again, that attendees that are reported on your group outreach forms, if you do one of those contact forms, or if you do the contact and stars for outreach. It's going to be kind of a total of everybody that was there. Say you go to a health fair and there were 60 people in attendance. You would get that general number of 60 and put it in. You'd put in the name of your the event and all of the contact information. And then, of course, your topics that you talked about or any of the brochures that you had out on your table, you would make sure that you mark off those things. But it does not count billboards. It does not count email. Any advertisements you do, those are more like fishing for clients. That's more of an advertisement type situation, and that doesn't count as an outreach. It's going to be only those booths, exhibits, enrollment events, and presentations that you do where you're talking about SHIP or MIPA. So for PM3, it is your Medicare beneficiaries under the age of 65. It is going to be people who are under 65 and, that's the key term, and receiving or applying for Medicare Social Security benefits due to disability. So on the client contact form, there is actually two boxes that are important here. It's the 64 and younger, and then it's also that receiving or applying for Social Security disability, and that's a little bit below the age box on there. So just making sure that you click yes on there. So if you talk to someone who says, I have SSDI, or I've been getting disability, I'm new to Medicare, but my Medicare's starting due to my disability, it's my 25th month and I need information, you're going to make sure that you click those two different things so it will count toward PM3. Sometimes I know that doesn't happen, and sometimes, it's, we don't understand what to click, but it's got to be that age and that disability box that we click off. So PM4, this is going to be our low-income, rural, and non-native English contacts. It is our beneficiaries below 150% of federal poverty level, so that's LIS numbers. So if you're looking at whether or not they are, say they're LIS eligible, then they would count toward this PM4 number. The rural contacts, that is based on what CMS uses and defines. It goes by county, and there's actually a long list of and you can find it on the Centers for Disease Control Health Statistics Rural Classification page. So they do have a page for that. When you get the printout of the presentation, in the notes section, that web page is on there. So you should get that. So if you print out like the notes pages, you should be able to see where to get that information if you're dealing with rural counties. So some of our regions have very small rural populations. Some are nothing but rural populations. So it just really depends on the counties and the zip codes that you deal with. Our non-native English speakers, it's going to be anybody that is not originally, maybe they do speak English, but it's broken English, and you know that English is probably not their first language. You would want to make sure that you click on the no section if that is the case. You can use your best judgment here. I know I have spoken to people that, you know, they speak decent English, but I can tell it's with an accent, and I will put no on there. So because I know they probably are not originally English speaking. So there is a method that ACL uses to calculate these hard-to-reach contacts. Very fortunately, they do that for us and total it up for us on our reports, so we don't necessarily have to deal with this, but we wanted to include it so you can see they do take a percentage, and then they do some math, and they come up with the percentage and the score on how many you've talked to. Some beneficiaries could fall into multiple categories, and they can be counted multiple times in both the total beneficiaries and the total contacted by SHIP. So you could talk to someone who is a non-native English speaker who is low income that lives in a rural county, and they will all count. That person will count 3 times. So the PM5 contacts, this is our total unduplicated enrollment contacts as reported on the BCF forms or the contact forms or STARS. So this, I know that unduplicated word kind of throws people off sometimes. I wouldn't let that bother you. It's really and truly, it's based on these 18 possible enrollment topics that you can include, and we'll go over those in just a moment. So if you are talking to someone and you write in one of the enrollment topics, that one enrollment topic is the only thing that's going to count. So if you talk to them about several of those enrollment topics of the 18 that we're coming up with, only one's going to count. So if you talk to a person and the first time you talked to them, you did a plan comparison, and you evaluated them if they qualified for LIS or MSP, and then they called you back to get enrolled. Once you click on enrollment, because you didn't put that on the original one, because you didn't do the enrollment the first time you talked, the next time that you talked to them and you did that enrollment, that would count as an unduplicated enrollment contact. It's going to be people, like if someone called back the second time and they were talking about, maybe they talked to you the first time about retirement insurance, and then they called back and talked to you the second time about Advantage plans. That's a unduplicated enrollment contact because you talked about different topics on each of the calls. So that's going to be the key. So let's go into the topics. It's going to be enrollment and disenrollment for any of the plans. It's going to be eligibility and screening on any of the options. For Medicare Advantage, plan non-renewal, plan comparisons, anything in, again, enrollment or eligibility of screening. Of course, benefit explanation is not on there because all of our contacts are some level of benefit explanation, so they don't count that. Really, we're trying to screen them. Are you eligible for Medicare? Do you get an assistance program? Maybe explain the assistance programs and try to get them assistance programs. Do you need any type of application assistance? Whether it's MSP or LIS, so it's going to be application assistance, application submission, and eligibility screening on any of the programs. So there's several different things that count. Just making sure that you are marking off one of those on each contact that you speak with. So if you talk to someone and you're only marking off benefit explanation, that will not count toward PM5. Everybody should be marking off at least eligibility screening for everybody that you speak with, because you are screening that you should be screening them at least for LIS and MSP, but you're also at least screening them to see if they have Medicare, because if they don't have Medicare, you're probably going to need to refer them to someone else anyways. So eligibility screening should be kind of marked on it, everybody. But those are the 18. So again, eligibility, enrollment, disenrollment, plan non-renewal, plan comparison, application assistance, application submission, and then MSP application assistance and application submission and recertification. So if you talk to someone about recertifying their TennCare, you can also mark it there. Okay, so does anybody, is there any questions about the SHIP? I don't see the chat, so I don't know. Is there any questions in the chat so far?
Looking right now.
Okay.
And I think we're good for now.
Awesome. Okay, so then I will go ahead and get into the MIPA performance measures. They're a little bit different than the SHIP. They're similar, but a little different. We'll go over those now. Okay, so pretty much everybody that we talk to should count as a MIPA contact. If you are screening them properly, then it will count as a MIPA contact. It's a simple question. There are programs out there that help you with your Medicare costs. Do you think you might qualify for these? They are income-based. You could explain. It's a very simple, do you want to be screened for assistance programs that help with Medicare? So we should be counting those. It does have to be entered into STARS. Our MIPA performance measures, they have started giving us goals, so they are going to count toward our numbers. So we want to make sure that we are screening everybody as and trying to help as many people as we can to get the programs. I mean, that's what we're here for. So we will actually add, starting October 1st of this year, we are going to start adding our MIPA performance measures to our QA routine. So if we're not meeting those numbers, it can hurt us. So we just want to make sure that we're getting those numbers and asking everybody if they qualify for assistance. So the criteria for performance measures, if you're a volunteer, we have to make sure that you are marked correctly in the STARS system. So if you go into your STARS profile and you do not see SHIP and MIPA marked on there, let your coordinator know so that we can add that in, because we do want you marked as SHIP and MIPA because you are both S&P as well. So if you're doing outreach events, if you're going to our health fairs or anything like that, you want to make sure that you have everything marked, because we send all of that information out and we want everything to count. So you have to have that, and when you do a contact form, you have to mark that MIPA yes. That is the first question on the beneficiary contact form. Was it a MIPA contact, yes or no? And we always want to mark yes on there. So our performance measures for MIPA is very similar, but a little different. PM1 is our overall MIPA contact. Again, everybody we talk to should count as a MIPA contact, and it is based on those LIS numbers. So whatever that the LIS numbers are for that year, that's what you look at. PM2 is our outreach. Again, it's going to be any outreach that you do at events and enrollment events. And it can be a specific LIS MSP event. So usually we have kind of an outreach where we have everything there, but it could just be that you're going and doing an LIS presentation. Maybe they want to know more about just those programs specifically, and it can be just MIPA. So PM3 is your MIPA target populations, and again, the target populations are really similar to the SHIP ones. It's going to be your under age 65, your rural Native American is included in this one, and also the English as secondary language. So we've got 4 separate ones. The way that they do PM3, they kind of divide those out as 3.1, 3.2, and so on and so forth. So it does break it up a little bit. That's the one big difference between SHIP and MIPA is PM3 is divided out a little differently. PM4 is going to be those contacts with applications submitted. So it's going to be the ones that you helped do the application and help them submit it, or you mailed it to them, getting them ready to submit it. So we'll go over that in just a second. Right, so PM1, your overall MIPA contacts, it's you've got to mark a certain subtopics on the client contact form or on STARS. Underneath the Part D low-income subsidy or the Medicaid topics discussed, you have to have on there application assistance, application submission, benefit explanation, eligibility screening, LINET. For the Medicaid, it's application submission, benefit explanation, buy-in coordination, eligibility screening, Medicaid application assistance, MSP application assistance, or recertification. There's also kind of an additional topic that's thrown in there that counts toward MIPA, and that's preventative services. So there is a wide variety of things that you could do here. You can, like I said, that one question, do you feel like you might qualify for any of the low-income assistance programs that help with Medicare costs? It's a really easy ask. if you are talking to someone and they've already talked about their yacht and they've gone to Bora Bora for the summer, you can kind of say you have screened that person to say their income is not going to be within guidelines. So, you know, that's a screening. So just, you know, in conversation is you, and it might not just be that one question, you know, that it can come up in conversation. You pick up on those little hints and things like that, that you can count that as a screening. Also, if you talk to them about, you know, the COVID vaccine or, you know, if they ask you, does Medicare cover the shingle shot? That is a preventative service, so you can count that towards your MIPA. So if you talk to someone about that, make sure that you are marking that MIPA yes at the top, and you mark preventative services at the. It's in the very last little box on the client contact form. So PM2 is going to be your outreach contacts. Again, that's going to be any presentations, booths, exhibits, any type of events like that counts. You want to make sure that you are checking off the correct topics when you are doing the client contact form. You want to mark low income and rural, and that you talk to them about extra help, Medicaid, MSP, or preventative services. Usually when we go to events, we have that preventative services flyer that we created up here at TCAD a few years back. And that counts toward that. So you want to make sure, you know, look at your table, see what's out there, and make sure that you have these types of topics covered, whether it's a LIS brochure or if it's a Medicaid application. Some people will put the applications and allow them to grab those. Those count as, it counts as a MIPA contact when you do that. So PM3, that is going to be our target populations, and it's going to be any of these topics. We got our application assistance or submission, benefit explanation, eligibility, LINET, the MSP applications, Medicaid applications, recertification. So if you're helping someone fill out a TennCare application, no matter what they're getting it for, whether it's Medicaid or an MSP, you can count that as a MIPA contact. If they are calling you and they're talking to you about maybe their Part B premium should be paid by the state, and they're not getting that, they're still getting it deducted from their benefits. That is a buy-in coordination issue, and that usually gets sent to me, and I handle that, but that counts as a MIPA contact. So just making sure that we just want to make sure you know that when you're talking to the people about these things, that they do count, and you do have to mark off that MIPA box at the top of the form. Also, again, that preventative services. They are going to break it down a little bit for us. So the beneficiaries under 65, again, you have to mark the age, and you have to mark that receiving or applying for disability or Medicare disability. So all the new to Medicare people who are turning 65 in a month or two, those are not going to count. It's going to be, they have to specifically be on disability, SSDI, or they've been on disability for 24 months and their Medicare is about to start. The rural beneficiaries, again, it's based on the zip code, and make sure it goes by county. And there's that website, the cdc.gov site has that information. And they break it down depending on how many people live in the town. And, that's not anything we have control over. We don't label, rural or not rural. That is all done well above our pay grade. So just getting in touch with your regional person to make sure if you go to an event in a rural county, that you're marking rural on there. Also, if you go to an event in a non-rural area, you have to have some level of assumption that people are going to be traveling to that metro area to go to an event, that they may be from a rural area. So you could even mark rural on those larger events with that assumption, especially if it's like a county fair or, a bigger event that, people would travel to. So like here in Nashville, we have the disability mega conference that I couldn't remember the name of it, the disability mega conference. We kind of assume that people are coming from all over the state to come to that event. So, we would make sure we mark rural on there as well. And it's the same rural definition as the SHIP performance measures as well. It's the same across the board. So the PM3, this is our Native American beneficiaries. We don't have very many Native American groups in our state. There are other states that have a bigger population, Oklahoma, North Carolina. There's several others. We do have, however, several smaller groups that label themselves as Native American. They span several counties over Tennessee. When you do get the printouts in the notes section, I have listed out a few of those Native American groups. Feel free to reach out to them. They are very, very supportive of their elder population, and anything that they can do to make it better for their elders, they are usually pretty keen on. So I'm sure they would love to partner with you to talk to, maybe have you guys out and talk to them. Just make sure if you do that, you're marking either the American Indian, or if you're talking to maybe a Pacific Islander or someone who's Native Hawaiian, you mark those as well. The English as secondary language, this is the 3.4. And like I said before, you can use your better judgment on this. If you are talking to someone who has a thick accent, maybe they are speaking clearly, but you can tell that they are not originally an English speaker. Just, use your best judgment. Maybe it's broken English. They are not fluent in it. You're going to count that as a no, as English is primary language. So PM4, this one is the big one. It's going to be contacts with application submission. So the only thing that counts for this performance measure is if you mark application submission or recertification on the beneficiary contact form. So if you help someone through the application. You got them to the point of they need to sign it and gather their information and send it either to TennCare, or if you went on to the LIS website and did the application with them over the phone and submitted that, that counts as an application submission. That TennCare application, if you do a phone call with them and maybe you do a three-way call with TennCare, you count that as an application submission. You might not be actually clicking that submission button, but you are helping the client get through that submission. Or if you're helping them with that recertification packet when they get it, and you are getting it to the point of completion where they're signing it and they're getting their data together to send in to TennCare, that is a submission. So you count that toward this PM4. Okay, that is all for performance measures. Do we have any questions? I'm going to get out. Stop sharing so I could see. If we have any questions? Okay, if they want the state to get their info on the LIS app, do we check both LIS and Medicaid? That is a good question. So for it to count, you must do a paper application. Just doing an LIS application, even though they send it over to TennCare, you can't count that as an MSP submission. So, because, you know, Social Security may screen them and find some resource that they didn't list for us, and if they don't qualify, they won't send that on to the state. So we don't know for sure that, you know, they send that on. So we want to, if you think they may qualify for LIS and MSP, you need to do both applications for it to count. Okay, do we have any other questions?
I don't see any, Lori.
Yep, I know. I was just kind of scrolling, seeing if I saw any hands up. Okay, so I'm going to get out of that. Oh, no. Are you guys seeing my PowerPoint?
Yes.
Awesome. Okay, so another topic that's really important for everybody to keep in mind is, you know, protecting the people that we're speaking with, you know, building that rapport, keeping their information private and confidential. It is of utmost importance, you know, HIPAA, and we'll go over that in just a minute, but you definitely want to make sure that you're keeping things covered, and we'll kind of go over some of the guidelines on what's involved in that. So we are going to go over what confidentiality is and how it works for us. We're going to look at the laws, we're going to look at policy, and how we implement it. We're going to look at some best practices that everybody should be using across the board. We're going to give you some of our expectations for the program, and then CMS does require that you sign a confidentiality statement. So we are going to go over that information so that you can get your unique ID. If you're going to be doing any counseling, you'll definitely want to use that unique ID so that if you need to reach out to Medicare Direct, you can help clients that way. So we'll go over that as well. Okay, so what is confidentiality? It comes from the word confide. So that means that someone is trusting in you or trusting in someone to share personal matters, health matters. Of course, then, that leads into them building confidence. That means that they have a trust or reliance in you, that you're going to keep their private information secret, and you're going to maintain that strict confidence. Then, of course, confidential, meaning that the information that they're giving you is intended to be kept secret. They don't want it out, broadcast to everyone. And then that confidentiality is our responsibility of refraining from sharing that confidential information. One of the things that I learned in nursing school is you never know who's in the elevator with you. So just because you are talking to another person and they're not there, you don't know, their cousin might be standing right behind you and you're telling all this personal information. So you've got someone kind of standing back there. Maybe it's a very important person who's there, and you are spilling the beans to, maybe it's the press, who knows. But the key word here in all of those definitions is trust. You want to make sure that you are building trust and you keep that trust throughout the whole process of working with our SHIP beneficiaries. So why is it important to us? It makes clients feel free to share their personal information. You heard Lonnie speak yesterday about all of the fraud scams. It's really hard out there. So you've got people that are scared to share their information, and if we start sharing information with other people, they won't talk to us, and we need their information, unfortunately, sometimes. But, we want to make sure we're building that rapport. It does make them feel respected. It makes them feel protected when we keep the confidentiality, and we are building the reputation of our agency and our program to know that we are a trustworthy program. People are not going to have us out multiple times if they think that we are sharing their information with other people. Of course, most importantly, we don't get sued. We don't want to get sued. Nobody wants to get sued. It's expensive, it's embarrassing, and of course, we are a nationwide program, and it tarnishes that program, so we definitely don't want to do that. So what are some of the rules that affect us as far as confidentiality in our SHIP work? Of course, federal law, that's one of the big things, it's the federal law. People have protections through the HIPAA Act of '96, the Health Insurance Portability and Accountability Act. There is also a privacy rule that, as far as rights and access to records, And then the security rule, which has to do with electronic things as far as data and some of the penalties there. Our state has some individual things that they look at as well. And then, different privacy acts and the privacy rights. Our agency policy, we have the VRPM manual that goes into our requirements as far as the programs, confidentiality, your agency, your AAAD that you do volunteer for, they have their own policies that you may need to follow. And then, of course, again, CMS does require you to sign a confidentiality statement to get a unique ID. So what is the HIPAA privacy rule? It is a federal law that protects all individually identifiable health information that's held or transmitted by a covered entity or its business associate in any form, whether it's media, electronic, paper, or oral. It's called protected health information. So it's information that is guarded, whether it be, and we'll kind of go over what falls under that title in just a moment. What is individually identifiable health information? It is going to be information, including demographic area, that relates to an individual's past, present, future physical or mental health condition. If a health care facility is giving care to someone, whether they were there 3 months ago, today, and they're going to have appointments later. So it's all of that is protected. Any payment information, billing information is considered protected. It's going to be some of the things like name, address, date of birth, social security number, of course their Medicare number, anything that's identifiably, and it's specific to that individual. So that's what is included. So does HIPAA apply to the SHIP and SMP programs? Technically, our programs are not covered entities. However, we do work with people that are covered entities, whether it be Medicare, if you are talking to TennCare, if you're talking to a doctor's office, any type of agency like that. Those entities are protected, so therefore we get that blanket. We're quote unquote their business partners, so we do get some of the. We do have to keep the information that we get from those people private. So what is the HIPAA security rule? It covers any personal health information that is created, received, maintained, or transmitted in an electronic form. So basically EPHI, it's electronic personal health information. It's going to be anything that was transmitted over the internet, whether it's stored on a computer, a CD. Say someone does their personal health information instead of in a journal, they keep it on a jump drive. That jump drive is EPHI. You want to make sure that that is protected. If they give that to you to look at an office visit, maybe it's got their drug list information on there and you download that information, making sure you're protecting that is utmost importance. Also, if they have it stored on their cell phones, sometimes I've actually had people have a picture of the list of their medication, and they'll open that for me, and I kind of type it into the plan finder off of their cell phone. That is EPHI. It is important to keep that protected. So security rule safeguards. So covered entities and their business associates, just that would be us, must protect against reasonably anticipated threats to and impermissible uses and disclosures of PHI. We need to evaluate the risk, look at where you're at, look at, are you meeting that person in a library, and, who's around you. You need to, look at that risk. Make sure that you are on an administrative level. You're making sure that you have your safeguards in place, whether it's a screen cover for all of the people that are working from a desktop that may be open, like I'm here in the office, making sure that that information is covered. If you need a physical safeguard, whether that's, getting into a private room, if you're doing a conversation that, might have PHI or EPHI, that people can see it, making sure that you're building that safeguard, having technical safeguards, and then, of course, making sure you have a documented policy and procedure in place for these EPHI. So SHIP and S&P operations for HIPAA. So we work with healthcare providers, and they cannot disclose a PHI without written consent or the individual's presence and oral consent. So when we are doing a call, or we are doing, maybe we're calling Medicare, we have the person in front of us, or maybe they've given us that information. We make sure that, we are protecting that. We have the client there. They give us permission, and we're making sure that we're getting that permission from the client. Then if we have someone, I know I have been in the situation where I've been on the phone with TennCare, and if the person is not on the phone with you, they will not talk to you. Social Security is the same way. If the person is not there with you or on the phone with you, they will not talk to you. That's the HIPAA protections. So they have to have you there. When we call Medicare hotline in our backdoor number, we have to use our unique ID. That way they can track if, that we called and we have permission, because usually we've gotten those 4 things from our beneficiaries so that we can call, their name, Medicare number, address, and date of birth. So, they can pull them up, and we use our unique ID to say that this client has agreed to allow us to talk to you. Anything that we send through email, we need to make sure we're using email encryption. Different agencies have it set up different ways. You could either, you might have to type in like secure or encrypt in the subject line, or maybe you have a specific program that you use at the AAAD that does the transmissions in an encrypted way. And then, of course, the HIPAA security rule is the model that we use for our VRPM information. So it affects us. It definitely affects us. Like I said, we're not a covered entity, but we are, and we kind of fall under it. We're under that umbrella. So some of our state laws, and I don't have them on the slide, but if you print out the notes pages, I put some of the information from the Tennessee specific state laws on there. So you do have that information. So some of the things, let me move this little box so I could see. So in Tennessee, healthcare providers must keep all patient records strictly confidential. They have to have written policies in place to limit use and disclosure of medical records. Even if a patient information is de-identified, so if it's been open, they still have to keep that protected. They can't sell it. They can't give names and addresses. They can't, unless it's to certain people. And it applies across the board to hospitals, nursing homes, ambulatory care centers, dental practices, HMO organizations, labs, any type of place that someone is getting care, they are protected under this HIPAA law. So I do have some information on there about some of the things that are also other things that are protected. So I'm not going to read through all of those. You can go through that. Oh, hold on. There we go. But it is on the notes pages when you print out the PowerPoint. So make sure you're printing those note pages. So what is personal protected information? So personal protected information is going to be a beneficiary's first and last name or first initial and last name in combination with any of these pieces of information: their social security number, driver's license number or ID number, bank account information, credit or debit card number, anything that's going to, when you have their name and you have that other piece of information, it identifies that person to that person. It does not include information that's lawfully obtained from publicly available information or from federal, state, local government records lawfully made available to the public. So there are some things that are out there that are in the public domain. It does not count those. That is not protected. So personally identifiable information and the protected health information, what's the difference between the two? Really and truly, the protected health information is tied to a medical record. That is the biggest difference. It does include a lot of the same things. Anything that identifies the person is protected, and then of course any data that is medically in their medical record is protected. So that is the biggest difference, is where is it found. The PHI for protected health information also can include their diagnosis. It could be their if it's a test result, a scan result. Sometimes you have films and things like that, and that may be in their record. All of that is protected. So you would need to make sure you're protecting that. Appointments, if they have an appointment and they have maybe an appointment card, that is protected if it has their name on it. So that's the key. Also, phone records for those clients, those are protected information as well. Anything that's medically disclosed at that time is protected. So what is a security breach? A security breach is any time that this information gets out. And it can happen. It can happen, you know, in numerous ways. You know, maybe someone got into your house and stole the computer that you work from, and you normally keep all of your client contacts on there. Maybe they overheard the conversation. Maybe you are like me. If I was sitting here talking about a client, I don't know who's on the other side of this cubicle wall. So, you know, they may overhear something I say about a client. So you have to be really careful about where you're at and what you're saying. Because like I said, a cousin might be right behind you talking, you know, that maybe it's a family member or something like that. Of course, we've got people that go in and try to get things out of trash. They'll come by and pick up things out of your dumpsters and trash bins. So that's, you know, we always try to tell people, shred your information, or, you know, keep it on file, burn it, do whatever you're going to do. But if it's got your personal information on there, don't put it in the trash, because there are people out there that will go get it. You know, if you have a piece of paper on your desk and it's got PHI on there, or if you run to the bathroom and you've got a file open that you've been working on, and somebody reads it, that is a breach. So you've got to be really careful about where you're leaving things and what you're doing. Or if you print something out that's important, that's got PHI on there, you need to, you know, be at the printer or the copier or the fax machine if you're waiting on something, so that you can get it pretty quickly. So there are people out there, once you, you know, destroy or get rid of it, maybe you're getting rid of a computer and you donate it to Goodwill or whatever, maybe you might want to go ahead and wipe your drive before you do that, because that information, there are some really smart people out there and they can do all of that computer stuff. I could not do it, but, you know, there are people out there a lot smarter than I am that will go in and they will reconstruct that data off of old computers or copy machines or anything like that. So, and it always seems like the scammers and the people that are out there looking for this information, they are always a step ahead of everybody. So they've got things in the works that we don't even know about. So we definitely need to just be aware that we can do our due diligence and keep things protected. Okay, so the SHIP volunteers, we do have our BRPM. In that manual, you guys should get a copy of that from your AAAD when you become volunteers. You should have a copy. If you don't, reach out to your coordinators and they could get you that copy. It goes over all of our confidentiality policies in there. We are responsible for maintaining confidentiality of all proprietary or privileged information that we're exposed to while serving as a volunteer or as a staff member. We have to protect that information. Like I said, it brings our program down. It puts us in a negative light when we are not protecting that information. So we definitely want to keep the integrity of this program. So confidentiality is of utmost importance. So how does it affect us as far as the VPRM? It's policy 3.94 in the VPRM. So how it affects us. you do have to get trained on confidentiality before you can get that unique ID. You have to sign that confidentiality statement. We have attached that to the test, so when you take the test electronically or in person, whether it's paper, you should get that confidentiality statement as well when you get that. So did I say something wrong? I probably did. I'm going to move past it, though. Volunteers are required to sign that written confidentiality agreement. You have to sign it to be a volunteer and, like I said, get that unique ID. So the agreement informs volunteers that the confidentiality breach is grounds for immediate dismissal. So if you do have some type of breach and that information gets out, we will have that discussion with you all that you will not be able to volunteer for us. So, okay, Sheila. And then you need to make sure that you're in full compliance with that VPRM agreement. There is, when you get the VPRM handbook, there is an agreement that you have to initial off on and sign off on the back, and that compliance to be confidential is also in that list of things that you sign off on. So you do sign off on it a couple of times. So some best practices, you want to make sure that you are using private space when you're doing a meeting, whether if you are, I've actually met someone, probably not the best place, but I met someone at a McDonald's, but I made sure that we were in a corner booth away from everyone. No one could see my screen because the wall was behind me, so nobody was going to be able to walk behind me and see. Same thing at a library. If you were meeting someone out in public, you want to make sure that you're away from everybody, that you're not going to have people passing by back and forth behind you that can maybe see your computer screen. Be as private as possible. You can use a computer screen blocker. They have those little UV screens that if you get off center in any ways, you won't be able to read it. Sometimes it does darken the screen a little bit, so not everybody loves those, but just making sure that you have your screen not open to everybody if you've got PHI available or on the screen. If you have any documents that contain PHI, you make sure that you're locking those up either in a locked drawer or filing cabinet that locks, making sure that you're keeping that information private so not just anyone can come up and grab it. If you have written notes, I know this affects me a lot because as I'm talking to people on the phone, I'm always writing down little notes just to kind of keep my mind directed. Just shredding those when you're not using them anymore or when you're done with it, or, you could always just scan those in and put them into stars if you want to file them away, or if have a file on someone, you could make sure you're putting it in the file and locking that up. So just making sure that you're protecting that information. So if you are talking to someone, say you need to call one of your coordinators, or you need to call Ryan, Alenka, or myself about a client and ask questions, make sure that you are doing that in a private manner. Know who's around you. Like I said, I don't know who's on the other side of this cubicle wall. There might be 10 people over there listening to what I'm telling you guys, but probably not, but it could happen. So I don't know that. So I have to assume I'm not going to be giving any PHI information to anybody because I don't know who's around me. Also, when you're sharing that information with the SHIP person or with, if you're discussing it with another volunteer, not all information is necessary to share. Just really using that minimum amount of information to get the point across, whether you need to get a little bit of information about how to help them, just share the information you need to share to get the information back that you need. You don't have to let them know the whole 9 yards of everything. Also, one of the things that I would like to do when we were at enrollment events, because before, when Medicare numbers were Social Security numbers, instead of someone calling out their number, I would have them write it down, and I would give that back to them so they could take that with them when they left. So, there's ways to keep that PHI where you're not having to keep up with it, and they have that information, but they don't have to call it out while you're there. Then also destroying documents. If you have anything that's PHI, there are ways that AAADs want to make sure that you guys are keeping what needs to be kept, destroying what needs to be destroyed. So just check with your local people to see what your coordinators, to see what their policies are on destroying documents, because some places, if it's been created, it has to be kept for a certain amount of time, so you need to make sure that you are either maybe blacking out the information that doesn't need to be shared, that you're no longer needing, maybe a Medicare number or something like that. You don't have to have that information. I know on our STARS documents, they prefer you not to enter that personal information into STARS. So, just making sure that you're following those protocols. Just get with your coordinators, and they should be able to tell you what those are. So our RPM IT policies, so we do have some policies specifically in relation to that ePHI. So you have to make sure that you're in compliance for controlling access to and use of beneficiary information. So if you're working on a computer and maybe you're on someone's Medicare.gov site and you're on their account, maybe you need to get up and go to the bathroom, either close your computer, lock it, make sure that you're not leaving it open so that people can come by and see, and it's any person. So if you're working from home, it could be, your significant other, it could be your children, anybody that can read the screen. You want to make sure that you're protecting that information. Also, if you're storing personal health information, you're making sure that you have a password. Make sure that the very strong password, that, don't go in and type in the word password as your password, because, that's easily guessed. So you don't want to do that. When you're using the internet, make sure that you are using that email use and appropriate, and make sure it's appropriate to for the websites that you're accessing. Make sure that you are if you're sending something ePHI, you're sending it secure, you're sending it encrypted. When you are connecting to a wireless device, making sure that it is a wireless internet that has a password. when you use your personal computer, make sure that you are following that VRPM policy while performing our ship work, because, personal computers, if you do anything ship on there and there's any question about a data breach or anything like that, they will have access to that. So you just need to make sure that you are protecting that information. So some do's and don'ts based on our VRPM. Let that VRPM be your guide. You really, really want to know what's in there as far as confidentiality and protecting people's information. So you do want to store PPI in a password-protected file on a password-protected computer to which only authorized persons have access to. So you want to make sure that you are protecting that information. If you do have a loss, maybe someone broke into your car and stole your laptop bag, that's that's not the ideal place to leave it, but if it happens, you want to make sure that you report it immediately to your regional coordinator. If you do leave your computer anytime, you want to make sure you lock it. Maybe close your screen. Make sure that if somebody came by and wiggled your mouse, that it doesn't pop up for them. Do clear your web browser and your history and your cache after you have worked on anybody's account. I know working with Medicare.gov as far as like the plan finder, and if you're signing into someone's account, sometimes if you don't clear that cache, that person's information could pull back up next time you sign in. So you want to make sure you're clearing that information. Use strong passwords or passphrases for your email accounts. Make sure that you're locking up any portable devices that you may be using for your ship work, your laptops, cell phones, all of that information. You want to make sure I would not leave them on the back seat in your laptop bag, because, if someone sees it, they may want to take it. So, locking it up in your trunk. Once you get home, taking it into your home with you, making sure that it's kept in a place that, it's not an open location. Some things you don't want to do. You don't want to send or forward emails with PPI to your personal emails. If you're working with the SHIP program, if it's somebody that you're working with and it's you're trying to send them information, that's one thing, but don't forward it to your own personal. If you're working from like a SHIP, say you're in the office and working on an office computer, but you're going to be working from home the next day, don't send it to your Gmail or Yahoo account. Try to get that information from the same email. Don't forward it. And then don't upload personal protected information to unauthorized websites. Anything that's asking for that information, unless it's Medicare site or, if you're helping someone with the LIS application, you don't want to use those unauthorized sites. And then don't use unauthorized mobile devices either, because you don't know, people like to mirror those mobile devices, and they may hack into your mobile device. It's really, they're not as protected as you would like to think. So it's best to not do it on a mobile device like that. So you want to make sure you're on the right type of network. Not all networks are created equal. Wi-Fi, if you're working out in the public, going to maybe a library or, going to meet someone at, a senior center or whatever, making sure that you are on a network that has a password, a good, strong password. There's definitely some risky things out there. There's people that, if you're on a free network, Wi-Fi network, maybe it's not secured. I know there are some like hotels and things like that that I've been to that, they don't have a password for their internet. It's open to anybody. Those are the types of networks you do not want to do this type of work on. So use a secure Wi-Fi network. Use your home network or a mobile hotspot if you have a mobile hotspot that has a password that's created with it. Make sure that you're using a strong password. Use those uppercase, lowercase numbers, symbols if they allow it, because you want to make sure that you are not, you're not making it easy for someone driving by that may want to latch onto your hotspot for a minute. You're not making it easy for them to sign on to your account. It is protected. Also, do not access or transmit PPI when using an unsecured Wi-Fi connection. So if you are on a public domain, maybe you went to the library or you're at a senior center and they don't have a protected Wi-Fi, or you're at one of those hotels that don't have protected Wi-Fi, make sure that you're not doing ship work that requires that PPI. There's definitely ways that people can hack into those. Like I said, that's above my knowledge level, but there are some really smart people out there, and criminals are some of the smartest. So they're stupid, but they're smart. But they're a step ahead of us on that. So just protecting that information. So here are some resources. We've got, there is a website that's specifically for the HIPAA program, and it will go over some of the details that I kind of skimmed over with it. You could definitely learn a lot from there. The SHIP Resource Library has a STARS security, like a information sheet that you could use. The SHIP and S&P resource libraries also have the VRPM information, reaching out to your local agency and your coordinators, your volunteer coordinators, to get that VRPM guidelines. And then, of course, the unique ID resources, they have information on that on the SHIP and S&P library as well. And that is it for me. Does anybody have any questions? Do we have? I will stop sharing so I can.
I'm not seeing any more questions in the chat, but if anyone else has any questions they want to ask, feel free to.
Yes, feel free to either raise your hand or unmute, and if you have a question about that. I know it's a lot, but, confidentiality is really, really important for us because, we want to make sure that we are the trusted source that people could go to. And that's really and truly, we want to make people feel welcome to talk to us. So I appreciate you guys letting me talk to you this morning. And if you do have any other questions about either performance measures or confidentiality later on, just let me know. Either send the message through your coordinators or get in touch with me direct. I'm more than happy to help you guys with the policies.
Okay, go ahead and start over.
Okay. I'm Amanda Johnson with the East Tennessee region out of Knoxville. I'm the program coordinator for this region and also the volunteer coordinator. So I'll be the point of contact for all of our volunteers. What we're going to discuss are ways that an individual can get help with their Medicare costs. So as you all know, Medicare doesn't cover everything, but there is help out there for those who have limited income and limited resources. The three programs that we will go over are going to be, I'm going to start with Medicaid. So that'll be the Medicaid program, the low-income subsidy, and also the Medicare Savings Program. Now, Medicaid, we won't go into a huge amount of detail because we specialize in Medicare, but we do have to have knowledge on Medicaid because a lot of our clients are dually eligible. So we need to know the main components of Medicaid and how it's going to compare to and also how it works with Medicare. Medicaid is a jointly funded program. It's administered by each state, and it's going to help with the medical costs for those with limited income and resources. The low-income subsidy, that's the LIS program, it's referred to as extra help. So when you hear someone say extra help, they're referring to the LIS. Now, that program is through Social Security, and it helps with the Part D, the prescription costs. It helps with the monthly premiums, the deductibles, the co-pays. Just remember the LIS, which is extra help, it helps with drug costs. And then we've got the Medicare Savings Program. Those are your MSPs. All of those programs pay the Part B premium, and possibly pay a little more than that depending on what program that someone qualifies for. So let's look at Medicare and Medicaid and some of the differences. Now, Medicare is the same everywhere. It's a national program that's consistent across the country. But Medicaid varies among the states. So here in Tennessee, we've got TennCare, that's our Medicaid. Now, the two programs are also administered differently. Again, Medicare is administered by the federal government, and Medicaid is administered by state government within federal rules. So that's that federal-state partnership. Now, with Medicare and Medicaid, there are also eligibility differences. Medicare, to be eligible, you've got to be, as y'all know, over 65 or within a disabled population. Now, Medicaid, the eligibility is a need-based program, and it's determined by financial and non-financial requirements. Now, there's also differences in who these programs mainly serve. Medicare is the nation's primary payer of inpatient hospital services. So again, Medicare is the nation's primary payer of inpatient hospital services to the elderly and disabled, where Medicaid is the nation's primary public payer of your acute health care, mental health care, and long-term care services. All right. So we've talked about the Medicaid portion briefly. Now let's go into the low-income subsidy. That's the extra help. And remember, that helps with the drug cost. So there's different ways that you can qualify for the extra help. Some people automatically qualify, and others must apply. Now, there's groups of people that are going to automatically qualify for the extra help. And those are individuals that already have full Medicaid coverage. Also, if you receive SSI, you automatically qualify for the extra help. If you have a Medicare savings program that we'll go into a little later, but if you do have the Medicare savings program, you're also going to automatically qualify for the extra help. Now, how do you apply for the extra help? You can do it online through the Social Security website. You can call Social Security. There's also a paper application that you can fill out and mail back in. Or, of course, beneficiaries can contact the local SHIP office, and we help with the LIS applications on a daily basis. So for the extra help, we're going to look at the income and resource limits, and this is for this year. These income and resource limits, they change each year, but specifically for 2021, we'll look at these numbers. Now, your income must be below 150% of the federal poverty level. So for an individual, it's $1,630 per month. For a couple, it's $2,198 per month. Now, it's based on family size, so usually we deal with individuals or couples, but every now and then you may get someone that's caring for another family member, caring for a dependent, and the income limit is going to increase as you add more family members. Now, when we look at the resources, the numbers that we see on the presentation, your resources are your savings, your investment, your assets, things like that. The resource limit for an individual is $13,290. For a married couple, it's $26,520. And of course, they don't count the home that you live in, because that would surely disqualify a lot of people for the extra help. And just keep in mind, the numbers that we're looking at here do not include a burial allowance. You can add $1,500 per person if you have funds in a separate account that's designated for burial expenses. So on the individual, that's going to up the resources to $14,790 if they have money set aside in a burial account. For a couple, we add $1,500 per person, so we're going to add $3,000 of that. There's $29,520 for a married couple. If someone receives extra help, they qualify for it, what benefits will they receive? Well, the first benefit is there's going to be a reduction in their monthly premium. And keep in mind, the plan must participate in this particular benefit. All the other benefits, there's no way for a plan to really opt out of those benefits. But as far as the premium reduction, their premium would be reduced this year by $30.20. So if you have a plan that participates and the monthly premium is under $30.20, then the beneficiary will not be responsible for any monthly premium. If it's over $30.20, then they're going to be responsible for the difference. Now, the other benefits for extra help, their co-payments are going to be reduced. The co-payment for brand name medicines will be no more than $9.20, and the co-pay for generic prescriptions will be no more than $3.70. There will be no deductible. and the individual is exempt from entering the coverage gap, the donut hole. Now, there are, the benefits that we just went over is full extra help. There are benefits for those that get partial extra help. So if someone, maybe someone's income or resources are really close to that limit, then they may qualify for a partial level of extra help. So you're going to see sometimes it'll say 25% or 50 or 75% partial extra help. There's even a 100% partial extra help. What that means is that is the percentage of the discount they'll get on their monthly premium. So instead of it being reduced by that $30.20, they'll get a 25% discount or 75% discount on their monthly premium. Also, prescriptions are 15% with partial extra help. There's no donut hole, and the deductible is reduced to $92 for those that get partial extra help. And again, how do we apply for extra help? You can do it through the Social Security Administration by calling them or by doing it online or getting the paper application, or you can call SHIP and we take care of those. All right, now let's talk about the Medicare Savings Program. The Medicare Savings Program, again, is a state program, so the income limits vary through each state. You may get someone that comes from Ohio or Florida or whatever state, and they say, well, I was getting this help in that state. Why do I not get it here in Tennessee? Well, it's because the numbers differ. So here in Tennessee for 2021, we've got the income limits for the Medicare Savings Program. I don't see the QMB on here, so we may need to update this PowerPoint. So there's a QMB, an SLMB, and then what you see on this screen is the QI1. So it's not on the screen, but let's talk about the QMB. The QMB is the Qualified Medicare Beneficiary. Okay, that's your first Medicare savings.
Sorry to interrupt you. If we want, we can pull up the cost tip sheet. It'll be on there.
Okay. Okay.
Let me see if I can find and send it to you while you go on, okay?
Okay. It was on the other PowerPoint, but not this one. I can just pull up this sheet that we have. It may be quicker unless you want to pull up the cost tip sheet, but can we see
Go
this?
ahead. Yeah, we can see it.
Okay. Okay. For 2021, now this sheet includes the $1,500 set aside for the burial accounts that I was referring to earlier. So keep in mind these numbers do include that additional amount on the resources. So for 2021 QMB, the income limit for an individual is $1,093. For a married couple, it's $1,472. The resources are $9,470 for an individual and $14,960 for a couple. So with the Medicare Savings Program, the resource limits are the same. It's the income limits that differ. So if you're under these numbers, you can get the QMB, just specifically these numbers right here, you can qualify for QMB. And remember, all of the Medicare savings programs pay the Part B premium, but the QMB does more than that. It'll also pay the Part A premium. So if you have an individual that doesn't qualify for premium-free Part A, their income is low enough, they can get the QMB. It also pays their deductibles, co-pays, and co-insurance. So people that have QMB, they're exempt from any cost sharing. They can show their Medicare card along with their QMB card. They won't be responsible for any of those A or B costs. People on QMB also are able to sign up for the special needs plans. I know in our area, all of our special needs plans do accept individuals with QMB. Now, the other programs, we have the SLMB and the QI1. The SLMB, as you can see, the income limits for an individual, $1,308. Married couple, $1,762, with the same resources. The QI1 is a little different as far as eligibility. The income limits are $1,469 for an individual, $1,980 for a married couple with those same resources. The QMB does the same thing as the SLMB. The only difference is that it's based on the amount of funding that the state has. So if your state doesn't have enough money, then the individual won't get the QMB benefit. But I've never seen it happen. Not to say that it'll never happen, or not to say that it won't happen, but I've never seen anyone that fall within those guidelines that have been denied the QI1 due to any lack of funding. So I'm going to go back to our presentation here. And it's also showing the extra help numbers on this slide, I guess, to kind of recap what those income and resource limits are. So just to recap again, we've got Medicaid, LIS, and MSPs. All right, Medicaid is your TennCare. It's a jointly funded program. It usually pays all the medical and hospital costs, leaving the beneficiary with very limited or no financial responsibility at all. If you have Medicaid, you're going to get the LIS co-pays are going to be a little different. They're $1.30 for generics, or no more than $1.30 for generics, or no more than $4 for brand names. People that have Medicare and Medicaid, those are your dual eligibles. They're full benefit dual eligibles. So we call those the full duals. And then again, to recap, the LIS is the low-income subsidy. That's your extra help. It's a federal program through Social Security. It covers the drug costs. And I think, as you all know, when you're doing the LIS application online or even the paper application, there is that option to send the application over to the state for the Medicare Savings Program. And then just to recap again on what the Medicare Savings Program is, that's through the state. Here, that is our Bureau of TennCare. All the Medicare Savings Programs pay the Part B premium, but that QMB does more. And individuals that have a Medicare Savings Program, they automatically get the low-income subsidy. When it comes to the Medicare Savings Program, we also handle state buy-ins. Let's say somebody qualifies for the Medicare Savings Program, but their premiums are still being deducted. We can get that straightened out. If somebody chooses to decline Part B because they can't afford it, and then later they get the Medicare Savings Program, we can go ahead and request that they get their Part B going for them. Now, this next topic, we don't deal with it regularly here, but we do often enough to where we need to discuss it. It's the LINET program. It stands for Limited Income Newly Eligible Transition Program. Again, that's your LINET program. Basically, what it does is it provides some temporary Part D. Part D is in drugs. It provides a temporary Part D coverage for low-income subsidy recipients who don't have a drug plan yet. So who can use the LINET? Anybody that has LIS, which is extra help. If they have that and they don't have a drug plan yet, then they are eligible for LINET. And with that group of individuals, it provides coverage on a current basis. Even individuals that have a Medicare Savings Program, but they don't have full Medicaid. If they have a Medicare Savings Program and they don't have their Part D drug plan yet, then they can qualify for some temporary Part D coverage through LINET. And those two groups, their coverage is on a current basis. There's other groups that get LINET coverage, but it's on a retroactive basis, and those are individuals that have Medicare and Medicaid. Those are your full benefit dual eligibles. And then if you've got Medicare and SSI, you can access the LINET benefits, but those are on a retroactive basis. So how does someone access LINET? They can access it in one of three ways. The first way is there's automatic enrollment by CMS. So CMS is going to periodically auto-enroll people into that LINET program. The second way is point of sale. So that's when a beneficiary is at the pharmacy and they present that pharmacy with an immediate prescription drug need. And the third way is through retroactive reimbursement. You're going to submit a receipt for prescriptions that you've already paid for during any eligible periods. So again, we're not going to go into too much detail on this, but we do run into it often enough. There's an open formulary. So there's no prior authorization. There's no network pharmacy restrictions. But again, it's just a temporary benefit for people that have the help, but they haven't chosen a drug plan yet. If you've got LIS, the benefit lasts about 2 months. And if you are eligible because of the reimbursement method, then that goes back from the date that Medicare shows that the individual was eligible for Medicaid or SSI. So if the client is being reimbursed, they're going to be reimbursed what they've already paid for those prescriptions, minus any applicable copays. And this program is administered by Humana. So if someone is unsure of whether or not they can qualify for this, if they don't have their Part D plan yet, and they're wondering, CMS does send out notices. It's a yellow paper, and it notifies them on whether or not that they're eligible for the LINET program. There's so when you're at the, and we've got the, there's a paper here that we can send or provide if you need it. It's Medicare's, it's the line at 4 steps for the pharmacy providers. It goes through in detail what the pharmacy provider is supposed to do if they're presented with this and they don't know how to run it through LINET. Then you tell them, and I don't really know what all this means. I'm not a pharmacist, but you've got the VIN number, the PCN number, all this great information that you provide to the pharmacist, and they will know how to run it through the LINET program. Okay. I think on this slide it tells you that information that you provide to the pharmacy in order for them to kind of know how to submit that claim. We've got some helpful websites on here. Everybody remember the Tennessee SHIP website. We've got Medicare.gov, Medicaid, Social Security website, the Marketplace website. So remember, Social Security is where you're going to apply for the extra help. Medicaid is where you apply for the Medicare Savings Program. And that can also be done through a TennCare Connect. So to apply for Medicaid and apply for the MSP, those are done through the Bureau of TennCare. It's TennCare Connect. There's a paper MSP application for those who choose to fill it out. And this is the link that'll get you to that paper application. We also have that application. It was updated this year, I think. So if anyone has an application with a date prior to January of this year, that's the old one. Good to know, there's programs for people that have limited income and resources. We went over those programs. The decisions that you make, they're going to affect the type of coverage that you get. So, you know, whether or not you want to use your Medicare and your Medicaid, your Part D, or whether or not you want to bundle all that into a special needs plan, you know, your QMB, those decisions affect the type of coverage you get. And decisions, a lot of those decisions are time sensitive. So if you don't want the Part B to be deducted from your Social Security benefit, then there's in a certain time frame that you need to apply for the Medicare Savings Program. If you don't want to start your Medicare and have high drug costs, then there's a certain time that you need to apply for the low-income subsidy. If anyone has questions or needs help, then Tennessee SHIP can absolutely help make the decisions that they need and when the decisions need to be made. And that's the end of the presentation on low-income programs. We'll see if there are any questions now.
Amanda, we had a question about getting a copy of that sheet that you had showed from the QMB or SLMB slides that were left out. I will let everybody know that in the presentations that were sent out this morning and yesterday, that slide is included in that presentation that includes QMB and SLMB.
Okay. Yeah, if anybody wants that cheat sheet, just let us know. I think y'all have that sheet too. And I know the QMB slide was definitely included in the one from the other day, so when I didn't realize that when I clicked on the one that was sent out today, it wasn't on there. So, do we have any other questions?
I don't see any questions, Amanda.
All right, thank you.
All right, thanks, Amanda. Hang on one second here. Let me take the ball from you here. And just to follow up with Amanda, everybody, Here's what some of those applications look like. With the extra help application, that will be obviously through Social Security, as Amanda had let everybody know. If you go to Social Security's website, you can find that application there. It's very easy to find the extra help application, even just going to Google and typing in extra help or low income subsidy program. It should be either the first or second. It'll be the second if there's some sort of sponsored post on there, but it should be the first or second thing that returns for your Google search. Some of the questions that are asked for extra help, the important thing to remember when assisting somebody with the application is that you do have to make sure that all of that information is accurate to what Social Security has on record. I will use my own family, for example. My grandfather had in Social Security's record, they had his birthday one day later than his actual birthday. It was August the 24th. Social Security had it as the 25th, and he had tried to get it changed in years previous. Social Security never really was able to accomplish that for him, and because he was a fiercely independent man, he did not want me to call on his behalf and get them to fix that. So whenever we had to handle any sort of application or any sort of paperwork for Social Security, we always knew, okay, we're going to have to put his date of birth to what Social Security has on record, not what his actual birthday was. But some of the information that they'll ask on here, if you mark that you're assisting someone else with that application, it will ask for your information too, what affiliation you have to that person. For example, we would mark other and put Tennessee SHIP down in there for our affiliation. They'll ask, do you have Medicare and supplemental security income or Medicare and Medicaid? You do not need to complete that application because you automatically receive extra help. They'll ask for some information like your first name, your last name, the Social Security number, the date of birth. If they do mark that they are married and have a spouse, they'll ask for that spouse's information as well. And then ask to make sure that they do not have any savings, investments, or real estate, not including the home in which they live, or one person or one vehicle per adult living in the household that would total up to more than those resource limits. Obviously, if you put yes on there that they do have more than what is deemed the limit, then they would come up with a page that says you would not qualify for this program based off of that. But obviously, if you put no, I do not have that, it takes you through to the remainder of the application. Some of the things that are asked on here will be the combined total of all bank accounts, stocks, bonds. If that person keeps a large sum of cash at home or anywhere else, if somebody was to, in fact, bury their money for some reason or keep it hidden away someplace, and they did not report that, I have no way of knowing how Social Security would ever back that up to make sure or try to figure out how they would know if somebody had a large sum of cash, stuffed in the mattress or buried in the backyard or anywhere else, but they do ask that information. They ask if any of the money listed above will be used to pay for funeral or burial expenses. Do you have any other property aside from your primary home in which you live? Do you have any relatives who are related to you by blood, adoption, or marriage that live in your home with you? What sort of benefits you receive: Social Security, railroad retirement, VA benefits, pensions or annuities, or other income not listed. If any of those amounts have decreased within the last year. If you've worked within the last 2 years, do you expect to receive any sort of calendar, any sort of income during this calendar year? And if so, are any of those amounts decreased within the last 2 years? If you stopped working or plan to stop working, I believe this is last year, a copy of last year's right here. So that's why it says 2019 or 2020. Obviously, on the website now, it would say 2020 or 2021. If you're younger than the age 65, or if your spouse is younger than 65, then they ask this question. If not, they ask you to skip to question number 15, which is, do you want us to send this information to the Medicare Savings Program? If the beneficiary requests that you do not send that forward to TennCare, then you can certainly mark no. Just myself personally, I always just tell people that they're going to send this application, or they reserve the right to send this application along to TennCare if they deem that a person may qualify for further financial assistance. Most people are okay with receiving that, so it typically just remains marked yes, on all of the applications that I personally submit for extra help. However, please do keep in mind that this is not a sufficient form of application submission for a Medicare Savings Program. If somebody does want to complete a Medicare Savings Program, you should absolutely complete one of the Medicare Savings or one of the TennCare applications in order to get them qualified for a Medicare Savings Program. TennCare has identified that it is one of the last forms of those application submissions that they give attention to. So it is not always the most reliable form of submitting that application. As was mentioned earlier, we have no way of knowing whether that application was received or that it was actually forwarded on to TennCare as intended, as Lori mentioned earlier. So if somebody is interested in also applying for a Medicare Savings Program, it is okay to mark yes on this, but also please complete a TennCare application in addition to this application. Signatures for any of this, if you do the online application, then this will be auto-filled, and it will just ask you to agree to the statements that by submitting this, you're authorizing Social Security to obtain and disclose information related to your income, resources, that will go towards checking to qualify you for this program. You can feel free. I always personally read that agreement to them just to make sure that they understand that anything that they've stated on there, that they are acknowledging that they believe all the information to be accurate and correct. Not every figure on this application does have to be exactly correct. For example, it asks right up here on number 4, what's the combined total of all your bank accounts? Somebody doesn't have to have that exactly right down to the penny. A good general figure will do. For example, if somebody said, well, I have $1,300 and it was actually, $1,350 or something like that, that's not a big deal. But if they tell you I have $1,300 and it's actually, $13,000 or $6,000, something that's vastly different, then of course that would be not something that they would need to be dishonest about at that point. Once you have acknowledged and agreed with this section, then you would be able to submit that application. What happens when you submit that application is that it brings you to a next page. It has all of the information that you just entered, and there will be a statement on the top that says the Social Security Administration has received your application for the low-income subsidy or extra help program on this date. At this time, it does have that down to even the second that was received by Social Security. We do print those application submission pages out and send those to the beneficiary, or keep one on record for ourselves, just in case that beneficiary was to in fact lose that of that application submission, just because if anything does go wrong, we do want to definitely make sure that those beneficiaries are able to have proof that they did in fact submit an application. Typically with the extra help application, we get very few reports back of any sort of issues with that application process. Social Security typically takes roughly about 14 to 21 days to render a decision and have that information back to somebody. It may be even sooner than that. But Social Security is typically pretty quick when it comes to that application process. Now, we looked at the extra help application. This application is solely for the extra help program. If we were to go right here, I'll just show everybody really quickly here. It does always take the computer just a moment to think. See, if I Googled, or Bing in this case, extra help, and it was the first thing that came up, ssa.gov benefits, clicked on that, and then of course it takes you to this page and shows apply for extra help with Medicare prescription drug plan costs. And if you follow, just keep following the apply button, then it asks for that same information that we were discussing. Are you assisting somebody with this application? If you hit yes, then it will ask you on the next page who you are when you're helping that, and all the questions regarding the beneficiary right there. Now, aside from the Social Security Administration, the TennCare application can be a little bit more hectic. With the extra help program, the first time that you complete that application, it may take you a little bit longer. But once you've completed that application a number of times, that application process goes by fairly quickly. Anywhere from 5 to 15 minutes is how long it typically takes somebody to complete that application. With the TennCare application, it is a little bit longer, and there are a few more sort of hazards that you have to look out for on this application. In the past, TennCare had their applications broken up a little bit towards specific programs. As of now, this TennCare application sort of is a catch-all for all TennCare related programs in there. So people do need to sort of be a little bit more wary of what they're marking when it comes to filling out these applications. That's why we're always a good resource for this process. So you can find this application at TennCareConnect.tn.gov. That is also the website that you would go to if you were interested in completing that application online. Tennessee SHIP is currently trying to work with TennCare to get a portal to allow us to have access to that website where we could complete those applications in bulk for all of our beneficiaries. As it stands right now, what a person would need to do for those applications is if you want to submit that application, you're going to need to create an account for each person who wants to apply online, which we don't really have the capability of creating new accounts and for each individual. So while the online application is going to be the fastest, TennCare has identified that definitely is their preferred method when it comes to receiving all of their applications. We do have the paper application always as a backup for completing these applications. It will have some instruction steps that will start that application off for what this application is for, who can use this application. Again, like I said, this application serves as an application for all portions of TennCare, whereas we focus solely on Medicare Savings Program aspect. So while this application could be filled out differently depending on what form of TennCare you are trying to get somebody qualified for our purposes, we're going to fill that out a very specific way. With scrolling down, if you're assisting someone with filling out this application, you can most certainly fill out this area right here. You do not have to put that information out there as someone helping you fill out this application. But if you do want to put that information down there and continue the assistance for that person, you can most certainly put that information down there. If you do so, just know that there is a chance that TennCare may contact you to ask any follow-up questions or anything like that. Some of those things are better suited for contacting the beneficiary directly there. So just be aware of that when putting your information down in here. And it will ask for the responsibilities of each person. If we keep going down to the third page right here, it will ask the information about the beneficiary, and you can see right up top here, it says use this application to apply for TennCare, Cover Kids, or Medicare Savings Program like QMB or SLMB. So you can always feel confident that yes, this application will work for a Medicare Savings Program. The same thing, you put all of the beneficiary's information in here to the best of your ability, the best of their knowledge. They should know all of this information right here. Tell us about your family. It will tell you who to include in this application, people you don't have to include on that application. And you'll go through and put the information about other family members in there. If you do not have any other family members in the household with that person, then obviously you do not have to complete for additional people, but this one is going to be for yourself right here for the beneficiary. So you'll fill out information about the beneficiary. It will be information such as their name, their date of birth, their sex, their social security number, their race or ethnicity. Please do note that that is optional on there. If they've ever been known by any other name, I personally have never had anybody say, yes, I would prefer to be known by this other name, but that option is available maybe one day. If they're interested in TennCare Medicaid, they have these plans to be choosing from. This is sort of where the tricky part of filling this application comes out, is that we do need to be careful with some of these questions in here. It is okay to mark for this question what that preference is, but when you get down to some of these other questions here, For example, question number 32, this is the question that typically trips most people up and causes the most the most problems with this application process. Is it asks a question like, are you over the age of 65, or are you an adult with physical disabilities, and do you want to receive home and community-based services? For a number of people, they would read that question and say, yes, I am interested in trying to receive some home and community-based services. But what this question will do, these next questions right here, 34 also will sort of be in tandem with 32, is this notifies TennCare that you're interested in receiving other information and trying to qualify for other programs within TennCare as well. Programs that would slow down the Medicare Savings Program application process. What this will try and qualify them for is a program like home and community-based services, or choices, which is care for people who would qualify for care in the nursing home but want to remain at home themselves. What that would do is start them down a process of having to get approved and get evaluations done to try and qualify them, and sort of gets in the way of that Medigap application process. So we do have to be very careful when completing these applications that we're not marking questions that are not actually due in part to a Medicare Savings Program right there. Obviously, questions like, are you enrolled in or entitled to enroll in Medicare Parts A and B? Those are important things to make sure that we're marking. And if you get right down past these two questions, it gets to number 35. Do you have Medicare and want to get or keep help paying Medicare cost sharing like QMB or SLMB? Right there, we're going to be marking yes, because that is exactly what we're using that application to try and get people help with, is trying to get them on one of those Medicare savings programs. They'll ask for current job and income information. Obviously, they've got not employed or self-employed, and let you know what question to skip to based off of that information. They'll ask if somebody other than a parent helps pay for food and or housing each month, and do you have medical or dental bills that you've received or paid in the last 90 days? Do you have shelter or utility expenses, dependent care expenses, or child support expenses? Yes or no. What do you have before tax reductions? How much are you paying for each one of these things each month? What other expenses do you have, such as alimony, student loans, tuition, other expenses? And then after that, that concludes all the information that they're going to ask about that individual beneficiary, and they start asking about all the other family members included in that as well. And you will enter, how many ever additional family members are needed, if I'm not mistaken here. They have 2 people included on this one, and then they ask to read and sign the application of all these various informations, and you have my permission to try and renew my eligibility automatically for the next how many ever years. The other important thing, if y'all will hang on just 1 second here. You'll see, questions about current jobs, and expenses asked on here. Okay, I can't find the statement on here just right off the top of my head, but there will be the chance, and in most likelihood, it's another place where these applications may get held up, is that TennCare will ask for proof for some specific things. They'll ask for additional documentation on specific things with this application. So it is always a good practice to just let some of the beneficiaries know that there is a chance that TennCare could ask for additional information. So when they submit the application, to just be wary of that and look out for those specific things, because that can be something that will hold the application process up. Any of the coordinators can feel free to speak on this as well, but sort of the things that really hold up that application process is one, the person just straight out does not qualify for it for some reason. Either they're receiving more money than they've told us, they have more in resources than they've told us, and they don't qualify. The other one would be if any sort of home and community-based services topics are marked on that application, then that would hold that application process up. And the third biggest one, I would say, is that TennCare has sent a letter requesting more documentation or additional documentation by a specific date, which is not always necessarily something that can be gathered in a very fast manner and sent back to TennCare, you know, as quickly as the beneficiary would like, and therefore their application gets denied due to you know, not receiving the additional documentation that was requested. So those are the things to just be very wary about and to pay close attention to when it comes to those applications right there. So let me pull up the chat here. Yes, the point was brought up that beneficiaries will receive a pink QMB card. That's the qualified Medicare beneficiary. That's the one that pays the 20% that Medicare does not pay on Parts A and B, and also pays that Part B premium right there. It's what most people are interested in receiving. And they will receive a pink QMB card, but they will not receive cards for SLMB or QI at that point. It was pointed out too that many people within the program, aside from just doing one-on-one paper applications or doing that through the online portal, will instead three-way call with TennCare and the client and complete those applications over the phone. That is definitely a viable way to accomplish that as well, and does give you the assurance of dealing directly with TennCare to complete that application on the beneficiary's behalf. And yeah, it was pointed out that once that call is started, that we can essentially mute ourselves and allow the beneficiary and the TennCare representative to to handle the question and answer process and allow us to just jump in if there are problems with the questions. Yeah, and Lori had pointed out that, you know, if we speak to someone and we're working with them and help them complete this application, whether they're in person with us and they sign it and date it and we fax that out, or we complete that online and submit that on their behalf, or as was pointed out, if we are conducting that three-way phone call with them and they complete that, if we complete the application and mail that to them to sign and date and allow them to either mail in themselves or send back to us to fax in, that would count as an application submission on our behalf. But if somebody calls and just says, I'm looking for a copy of this application, and we mail them a blank application, that would not count as an application submission on our behalf too. We have to have some level of assistance given to them in helping them complete this application prior to them sending it to them or submitting it on their behalf to count as application submission. Yeah, there were some comments that, you know, documentation, the TennCare request of documentation by a specific date does trip up people and is very difficult for people a lot of times. But we can always, you know, have somebody collect that information and either send it to us for us to fax on their behalf if they're up against that deadline, or you know, they can fax that themselves. Faxing obviously will give them a receipt of submission, so if there is any sort of issue with that process, they will have proof essentially that they did in fact submit that on time prior to the deadline of it being requested. And with those applications, there can be a wide variety of time it takes to render a decision on those applications. Yeah, it was also pointed out DHS will also fax that as well. As TennCare has told us, with the online application, that process can be very quickly. It can be you know, as soon as 24 to 48 hours. They quoted us that typically, you know, around 7 to 14 days is what their average time through the online portal. That would not be what most people would probably characterize as the time that they've experienced it taking. For the most part, I would say that the overwhelming experience of the program has been that application takes 45 business days TennCare takes 45 business days to render a decision on those applications. Typically, you know, most of the time, the large majority, at least in the past, of our dealings with the Medicare Savings Program have been through paper application, and it is the time that takes the longest to render a decision on those applications. So it may be forewarned to people that this process could take as long as 9 weeks to make a decision on this application. In the past, people were not allowed to submit those applications any sooner than, or I should say any farther out than 30 days prior to their Medicare beginning. As of now, Those applications can be submitted up to 45 days prior to a person's Medicare starting, and TennCare has given us the assurance that they are currently working towards extending that to up to 90 days prior to the date that their Medicare becomes effective, which would be extremely beneficial for our beneficiaries, considering that that process could take so long. And typically, once a person does start receiving those benefits, we do typically see that there is a 2 to 3 month turnaround before those benefits start kicking in and TennCare starts paying those premiums. They do issue reimbursements for the months that that person's assistance was effective, but those benefits had not kicked in. They do send out a reimbursement for that, but we do typically see that turnaround is anywhere from 1 to 3 months right there before they start seeing that money stop coming out of their monthly check. So what I'm going to do is I'm going to go ahead and pause the recording. STARS is our data system. That's what we'll cover here. It stands for the Ship Tracking and Recording System. And I'll go ahead and just show everybody. It was included in your information that we had sent out yesterday and this morning. But this is going to be the link to the STARS website right here. It is going to look like this once you get to that website. Now, if you have not been set up by your volunteer coordinator or by one of your fellow volunteers who has access within the system for an account, you will need to get in contact with your volunteer coordinator in order to get that account set up. All of the coordinators across the state have access to be able to create a user profile for you in the system. Data entry is solely one of the most important aspects of our program, as is something that I've been known to say and that is very true with our program is if it is not entered into STARS, it did not happen. We could counsel 1 million people within a given year, but if we only entered 100 of those people into STARS, then all that work was for naught. STARS is the data system that took over for our program about 3 years ago now. It took over from Ship Talk. If any of the volunteers who are on this recording right now have been with our program for a number of years now, you may remember Ship Talk if you did in fact do any sort of data entry for our program. But STARS has, it's been quite the process with STARS. We have had many different growing pains when it comes to this system, and now we are still learning new things, and they're putting out new reports at all times. So what I'm going to do is I'm going to go ahead and get logged into STARS using one of our agents' information here, one of our call center agents. I should clarify that. If y'all will just give me 1 second here, I'm going to go ahead and just enter that information into a window outside, just so I don't put that person's login information out on a YouTube recording here. Then what I'll do once I've gotten this entered in here is I will just pull this other screen. Perfect. Now, I did mention that what we'll show on here is going to be dependent on what level of access you are given within the data entry system. For somebody who may work for the program or do a good majority of the data entry for the program, you may be given more access to be able to enter into the system multiple people's entries. However, for somebody who only has access to enter their own data, you may not see as much information on here or may not have access to do as much as what will be displayed, but we will cover a multitude of different things through this presentation of what capabilities we have with our data system. Again, if you are interested in volunteering and doing data entry, this will be something that you could refer back to if you were interested in making that one of your primary functions of volunteering with the program. You know, we always have data to be entered, so it is something that is absolutely extremely useful for our program. But just what STARS looks like once you've gotten signed in, you have everything that you can where you can go to access your account, change any information in your profile. If you were looking to switch your password, if for any reason you felt like you may have left your list of all your username and passwords out and somebody may have tried to take that to use without your permission, you can go in and change your password in there too. Sign out and the help, your name and what your volunteer role will be is right here. You'll see more of these different volunteer roles once we cover entering in team members in a little bit here. But if you look right here on the ribbon, that's going to go home, the tracking inbox, search, reporting, and configuration. On the home screen here at STARS, some of the things that you'll see is your tracking inboxes for beneficiary contacts, for group outreach and education, for media outreach, and for team members right here. We will go into what each one of these are in depth a little bit right here, but just know that this is sort of going to be a summary page of all of your different activities on the STARS website right here. So what we'll do is we'll just work our way right across this ribbon here and go through all the different capabilities of STARS. So what was covered this morning, I'm going to be building a lot on the performance measures and some of the topics that Lori had spoken about this morning regarding what we're marking and what's counting within our program. So what we'll do is we'll start right here in the tracking inbox and just go through everything. For our one-on-one Medicare counseling, we're going to be entering beneficiary contacts for that. On the tracking inbox, it has all of these different things laid out. The tracking inbox is what we're going to be using to enter new forms of each one of these different categories of things. We're going to start at beneficiary contacts. These are our one-on-one Medicare counseling. Essentially the bread and butter of our program. It is our one-on-one Medicare counseling right here. So if I just go to tracking inbox, go right down here to beneficiary contact, and once I hover over that, it will open up and say new beneficiary contact. And if I go ahead and click that, it's going to go ahead and pull up our beneficiary contact form. This form is going to look the absolute same for every person that we enter on here. So what I'm going to do is just sort of go through a random but accurate, I would say, encounter of what we may do whenever we're counseling somebody, how we would enter that. So if I'm answering the phone, cold call with a individual, you know, obviously some of the things that we're going to ask is for that beneficiary's first name. His or her first name is Test, and last name is Subject. I do have the ability to delete these contacts out of here, so please don't believe that I will be leaving Mr. or Mrs. Test Subject in the system after this presentation is done here. We find out that their phone number is 5309. And they're not giving us any email address at the moment, but they've called us to get some Medicare assistance today. I'm going to sort of tailor this conversation that I have with Mr. or Mrs. Test Subject to going down. I know, I apologize. I've always got Jenny's number locked in my head there. But I'm going to tailor that conversation in a way that will flow with this beneficiary contact, you know, most easily. So, you know, Test Subject here has contacted me saying I'm interested in Medicare assistance, and I'll say, well, let me first ask you, is the assistance that you're or information that you're asking for in relation to some financial assistance? Do you have any trouble paying for your Medicare? Are you able to afford all your prescriptions and your doctor's office visits? Do you have any sort of financial barrier that's bothering you with your Medicare? However you want to try and assess, or let me first ask you, what's your monthly income, you know, so I can help you try to find as much assistance as possible. However you feel the most comfortable with asking those questions, they say, so because I've asked that, because I've screened them for that financial assistance, then I'm going to mark NIPA, yes, for that. Going down there for that, it's going to ask what your partner organization affiliation zip code is. I'm going to go ahead and enter the zip code that I'm at right now. It will say session conducted by right here. That should autofill to your name as well. If this contact was in any way also affiliated with any sort of fraud or abuse, then you would need to mark yes to send to SMP right there as well. And then it's got your SIRS and SHIP reference number. These will appear after we've completed the contact, so those will just remain empty for at the moment. But the partner organization affiliation zip code, that's what zip code am I at right now conducting this assistance. And then, of course, once we fill that, it should already have Tennessee open. But what it will do is it will autofill that county. I'm going to go ahead and see if I can't get one that will pop up multiple counties. So if I put 37604 and go down here, I say, well, I don't live in Carter County. It is what popped up, but I'm not actually in Carter County. I'm in Washington County. So I can go ahead and change that county right there. And that's just information regarding myself. I'm conducting this contact. This is where I'm at when I'm conducting this. This is what county I'm in. And of course, the state is Tennessee. We should not be talking to somebody outside of the state of Tennessee unless they are A, moving to the state of Tennessee soon, or two, have whoever they're calling about does in fact live in the state of Tennessee. obviously, if we're talking to the actual person looking for assistance, we're going to put all of that person's information in the beneficiary information boxes. If we're talking to somebody who's representing a beneficiary and they're in fact going to be discussing something in particular, then we would put the representative's name and information in here and then put the person that we're talking about as the beneficiary right there. Past that, it will ask what the state of the beneficiary residence is. That should be autofilled to Tennessee as well. And then the zip code that they're asking about, you'll go ahead and enter that. So we're going to say that test subject here is in 37221. And they are in Davidson County. There is not another, oh, yep, there it is. I was about to say. They are in Davidson County. That is what auto-filled, and it is correct. You'll see that it also gave me the option of Williamson, but they are, in fact, still in Davidson. The date of contact is right here. It is going to auto-populate to whatever today's date is. If you are entering data on previous contacts that you've had with somebody, for example, I myself, whenever I do any sort of client contacts, I do my very best to enter the information into STARS either directly after that contact or during that contact. So I don't have to worry about going back and entering that. But if I'm entering data on somebody else's behalf, or if I've had a very busy day, a lot of people have been contacting me and I have not been able to maintain keying all of those in live, then I will absolutely make sure that the date that I conducted this assistance is correct in there. You can either go in there and enter that information manually, or if you want to, you can click on this little calendar right there and select that data yourself as well. Right after that, how did the beneficiary learn about SHIP? There is a drop down for each one of these. However, if you do enter any sort of letter, it will automatically push down to whatever you're looking for. We're going to say that test subject here was sent to us by 1-800-Medicare. So I would just go right down here, search through there and say 1-800-Medicare. The method of contact that test subject is contacting us by. There are, multiple different methods of contact. Email, of course, face-to-face at the beneficiary home or facility. If we are going out to a site or to somebody's home to do that counseling, then that's what we would put. If they are coming to us or coming to one of our counseling locations, then we would make sure and mark that. If it is over the phone, then we would mark phone call. If we're responding to a letter or a worksheet that we have received by mail, then we would put postal mail, or if we were faxing it to them, then fax, obviously. And if this was some sort of chat function that we had through one of our websites or a messaging system, then we would put web-based right there. If you're emailing somebody, please put email. But if you're chatting back and forth the counseling, then obviously you can put web-based right there. Just for the ease of this, we're going to say that test subject called me right there. The beneficiary age group. This is something that not everybody may feel comfortable about asking somebody their age. So luckily you don't have to ask them their specific age. You can get a general age range. If they're 64 or younger, that's something that's very important, as Lori mentioned earlier, that goes towards our are under 65 and disabled, that's one half of that. So if they're 64 or younger, we definitely want to make sure and mark that. 65 to 74, 75 to 84, and 85 or older. You obviously can put not collected. We use that as a last resort. We always do want to try and ask and figure out what somebody's age is, since it is crucial to our performance measures right there. Please ask somebody's age when it comes to that. I'm going to say that test subject is age 66. There is something that I will go ahead and mention as well is for various people throughout our program. There is always a little bit of a debate about anybody's personal preference on this, but if you are speaking to somebody who is 64, but they are about to turn 65, so let's say they're within their initial coverage period, there are some people who would mark that person as 64. Some people would say, well, if they're going to be 65 within the next 3 months, I'm going to go ahead and just mark them as 65. There is no way that is going to harm our program or anything like that. It is merely a point of personal preference. I'm sure that we could take a poll in this entire meeting, and you would have a number of people who go ahead and just mark them as 65, and a number of people who say, well, they contacted me, and it doesn't matter if they're turning 65 next week, they're still 64. Either way, you know, it's not going to be crucial unless they are obviously under 65 and on Medicare due to disability. In that case, it would be very important. Beneficiary gender, again, this is something that some people may feel uncomfortable with asking. This, however, is not something that is a part of our performance measures. The gender and race are merely for us to be able to check with our statistics in our data system to make sure that we are, in fact, serving all the various groups within our state, either gender or race. So if somebody does feel uncomfortable with trying to ask, you know, what a person's gender is, we do have the options of male, female, other. We actually petitioned against other 2 stars, but they put other right there and then not collected. We had actually petitioned for prefer not to say or you know, identifies as something other, identifies differently than what they had put right here, but they had just they had not agreed with that idea and put other right there. Not collected is of course an option, but if you cannot imply that or do not feel comfortable asking that, you do have the other option there. I'm going to go ahead and say that test subject is female. For anybody who is unaware, sort of the average, let's say, or most prevalent, just from statistics, the average SHIP beneficiary that we assist would be a 70-year-old white female in Tennessee. That's not anything that is super important or would be on the test, just a fun fact from statistical standpoint. We're going to go ahead and say that test subject is identifies as multiple races. They say American Indian, Black, and Native Hawaiian. The races are broken down. American Indian or Alaskan Native is more clear. Asian, the way that Booz Allen Hamilton, who runs STARS, their view on that is that Asian sort of encompasses the entire Asian continent. So Asian could be anything from Russian to Indian, actual Indian to Middle Eastern. So it encompasses quite a lot to China. So that could encompass quite a bit in Asian right there. Black or African American, Hispanic or Latino, Native Hawaiian or other Pacific Islander, white and then not collected. Again, race is not something that counts towards our performance measures. It is merely a tool for us to make sure that we're doing our best to try and serve all populations within our state. As Lori mentioned earlier, is English a primary language? If you can, if it is implied or easily understood that this person does not have English as their first language, you can feel comfortable with marking no, English is not their primary language. If you are in doubt of whether English could be their primary language, you can feel free to mark yes on that, but we go ahead and mark that. Of course, you can always ask. That's always the easiest thing. And most people, for any of these questions, most people, in my experience of doing this for 8 years, just appreciate you taking the time to ask and make sure what they feel comfortable with, rather than sort of feeling strange or dancing around the subject at any point. But if you do not feel comfortable, you don't have to feel like that you have to directly ask right there. We're going to go ahead and say test subject. English is their primary language right there. And when I asked test subject back up here if they had any trouble with paying for their Medicare, they say, well, I do feel like that I'm paying quite a bit for my medications, and I would like to see if I would qualify for some sort of financial assistance. So I ask them, well, what is your monthly income? And they tell me, well, I don't make very much. I make about $800 a month. And of course, from looking at all the financial assistance information that we were looking at earlier, we would know that $800 is quite a little bit below all of the income limits to qualify for any sort of financial assistance. So at that point, we would say, okay, well, your income is going to be below the federal poverty limit. The options, of course, are at or above the federal poverty limit, below the 150% of the federal poverty limit, and not collected. Again, not collected is last resort. There really should not be one single contact that we are speaking to within our program that we are not screening for financial assistance. Whether they are identifying to us, whether they are struggling with payments or have made it very clear that they have plenty of money to be able to afford everything, that also could be an indication of screening. If they are, talking about that they're not paying very much for their medicine, or that they're having to pay an increased Part B premium due to their 2 months previous tax return, then that would also be a good indication of that they're above the federal poverty limit right there. It's still a good idea to still ask, because just because their tax return 2 years previous, they were in a higher income bracket, doesn't mean that income has not dropped down since then. So always good practice to still just ask. So I asked them, they told me I make about $800 a month in my income. And I say, okay, well, you're quite a bit below the federal poverty limit then. I say, well, how much do you have in terms of your resource, your savings, investments, real estate, not including your current home? And they say, well, you know, when my parents passed away, they left me quite a sizable inheritance. So I probably have about $120,000 in my savings from that inheritance. And so, okay, well, that's quite a bit above to 150%, or excuse me, quite above the resource limit for someone. So you're going to be above the LIS asset limit there. So don't always assume that just because they're below in their income that their resources wouldn't, you know, bring them above that limit as well. And since this person is 66, like we discussed, they're not below the age of 65, so they would not be receiving Medicare due to disability. It does not matter either if they used to receive Medicare due to disability. You know, we covered it, I believe, on Monday, but somebody can, in fact, receive Medicare due to disability, you know, anytime below the age of 65, but once they do age into 65, they then transition from Medicare due to disability to just being on Medicare due to attaining the age of 65 right there. So because this person is 66, they're on Medicare just solely because they are eligible for it due to age, not in fact because they are on any sort of disability. Through the course of this, we've discussed, okay, well, you're not going to qualify for financial assistance. So what can I help you with? And they say, well, you know, I'm really looking to, I'm just moving here from another state, and I really need to find what my best options are in terms of my Medicare at this time for when I move to Tennessee. My options at that point would be to try and describe what their options are in a very broad sense. Tell them about, you know, their original Medicare, and then, of course, talk to them about the Medigap policies, the Medicare Advantage, and prescription drug plans. Allow them to sort of guide the way that discussion goes with what they're interested in. Obviously, if they're interested in all three of those, then we will absolutely do comparisons for all of them. But if they're leaning more one way than the other, then we can allow them to lead that. So we're going to say that for test subject, they've identified, yes, I did in fact take Medicare A and B when I retired at 65. I had a Medicare Advantage plan. After that time, I'm, you know, about 4 months into being 66, and now I'm moving to Tennessee. And while I would like to, while I have been interested in Medigaps, ultimately I just don't think that I'm interested in trying to take a Medigap due to cost of that. I think that I'm more interested in looking at a Medicare Advantage plan. Excuse me, I'm sorry, y'all. It does give us warning timeout boxes here. Test subject says I'm really interested in getting some information about Medicare Advantage and prescription drug plan information. So at that point, I would either tell them, hey, I'm going to email you this worksheet for you to complete, scan, and send back to me to do a comparison, or if they would prefer, I would take their information over the phone, their list of medications, and run that comparison for them and mail that to them. So basically what I've accomplished on this in terms of what we've talked about through that scenario is I've talked to them about their financial assistance programs. I've screened them to make sure that they do in fact receive. I've screened them to make sure that they do in fact receive Medicare. We've talked about what options they have and sort of explain the benefits of each one of their options. And we've ultimately decided that what I'm going to do is talk to them about, I've talked to them about what their information is, and that I'm going to run a prescription drug plan and Medicare Advantage comparison for them and mail that out to them. I also, before I hang up, tell them to be wary because we're in the midst of the big COVID vaccination push right now. I tell them to be wary of anyone asking for payment, for scheduling one of those appointments, for asking for money in exchange for getting one of those vaccinations, or for anybody calling them to try and gain any of their personal information in order to either receive or schedule a vaccine appointment, any of their personal information being, you know, things like their Medicare claim number or anything like that. And then after that, we conclude the phone call. So through that, what topics that I would discuss would be under original Medicare, because we did screen them for receiving Medicare and sort of explained what their Medicare does. I would mark eligibility for screening them and benefit explanation for discussing that. And because we did discuss some fraud and abuse as well, I'll go ahead and mark fraud and abuse. For Medigap, we did screen them to make sure and see if they were receiving one or were eligible for one, and did explain all the benefits of that, but they decided not to get a comparison on that. So we're not going to mark plan comparison on there. For Medicare Advantage, we did explain the benefits of that, and we did screen them. And they did say they were interested in receiving a Medigap, or excuse me, I'm sorry, a Medicare Advantage comparison. So what I'm going to do is I'm just going to scroll down here to plans comparison. And the same thing with a Medicare Part D plan. They did, we did discuss their eligibility and explain the benefits that go along with that. And because they did want a plan comparison right there too, I'm going to mark that for plan comparison. For extra help, because I did screen them and we did go through that, but we did not get anything past that screening process. Then the only thing I did was eligibility and screening. Typically, when I'm doing a contact, I do explain to them the benefits of that program regardless, because just because somebody is over the limit to qualify for that does not necessarily mean that they cannot apply for that. We definitely always do tell people, here are what the limits are, but if they're adamant about wanting to apply, of course we do help them apply. But in this specific situation, the only thing I did was screen them. We didn't go any further than that. So I'm marking eligibility and screening. The same thing with Medicaid, because I screened them for their income. I'm marking eligibility because I found out that they had such a large inheritance, and they did not really press me about wanting to apply for that when I told them that they would be, you know, pretty well over the limit by the limits that were put out by TennCare. They would be pretty well over the limit to qualify for that. They didn't want to take that any further there. And after that, I have marked everything that we discussed. I'm going to say that I talked to this person on the phone for 30 minutes. After that point, I went in and did their comparison, printed that out, highlighted it, scanned it in and emailed it to them, and then came, after I emailed that to them, came right here and entered that in. So after the 20 minutes that I spent talking, or the 30 minutes, excuse me, I spent talking to them, I spent another 30 minutes running those comparisons, emailing and keying this in. So at that point, I'm going to mark down that I spent 60 minutes on this contact. You can feel free to put in, that in hours as well. It will add up if you do both of those as well. But just because it's easier for myself to keep up with minutes rather than having to break down, if I spoke to somebody for 95 minutes rather than going, well, that's an hour and 35 minutes. It's always just easier to do minutes for me. That is up to entirely your preference as well. But at that point, I spoke to them for 60 minutes. I contacted this person and I sent them that comparison, but I would have the expectation and would have put that in their cover letter of that comparison, that if they had any further questions or were interested in trying to get signed up with or enrolled with any particular plan, to please feel free to contact me again. I would have the expectation that they're going to take a look at that comparison and going to contact me back in order to make a decision on those. So in this case right here, I would mark in progress. If for any reason I had spoken to this person and they told me, well, I don't take any medications, and I was able to complete that comparison while we were on the phone, and they had told me, and they had told me that they were going to make a decision and were going to contact the plan to get signed up rather than do that over the phone because they wanted to ask specific questions, then at that point I would mark complete there, because I would know that, okay, they're not going to contact me again. But just for the purposes of this contact, I'm going to mark in progress right there. The same thing if, because I'm not enrolling anybody into any sort of plans, I'm not worrying about what the original drug plan cost or new drug plan costs are right now, although I will keep that comparison sheet. So if they do have any questions or if I do end up doing an enrollment for them, that I will have that information to be able to put that there later if I have another contact with this person. Any of the information that I run when it comes to comparisons or any print-offs that I have on this client, then I would scan in and upload into the system there. And then after I've done all of this, I hit save. And then it thinks for a minute and it saves. It brings you right up to the top of the page that we started, right up at the top of the page we were just on. But now you'll see that there's a ship reference number right here. And this is what you really want to pay attention to when it comes to knowing that your contact was submitted correctly. Once you see a ship reference number, you will know, okay, yes, the system has accepted this, and I'll know that now this has been entered in correctly. If for any reason something was wrong or not marked, let me see if I can resubmit this now with that not marked. Yeah, if something, you had forgotten to mark something or something was not correct in there, then when you tried to submit that, it would give you a validation error up top right there. And then you would just be responsible for finding what that was and making sure that that got entered at that point. And then, after that point, you can either hit home, or if you've got somebody new to to key in, then you would just follow that same thing, tracking inbox, beneficiary contact to new beneficiary contact, and you start that process all over again. So that's entering a new beneficiary contact. If we go right back to this tracking inbox too, you'll see that right down from beneficiary contact is group outreach and education. So what we're going to do is just do the same thing. We're going to go hover right over it and go over to new group outreach and education. Now, group outreach and education are the contacts that are going to count towards our performance measure 2, our outreach contacts. Those consist of 3 different things, like Lori told you this morning. They are presentations, booths booths or exhibits at health fairs or community events, and annual enrollment events. Those are the 3 things that counts towards our performance measure 2 contacts right here. So let's say that I had a presentation with the CMA Music Festival. Somehow I got in contact with the city of Nashville, and in between Brad Paisley and Kenny Chesney performing at the CMA Music Festival, I was going to get up and give a 15-minute presentation regarding SHIP and Medicare. Yes, I can assure you that should that ever happen, that I will call every single person within the program and make sure that as many of us get up there and present. Yeah, we'll call everybody in the program to just get up on stage together. Sounds like a good deal right there. So through that presentation, we're going to make sure that we touch on a number of things about our program. If you want to put this in another way, let's say that we've got a booth set up while the CMA Fest is going on, so we can sort of give a varying degree of these things. You know, while we're up giving this presentation, we're going to want to make sure that we mention everything in order to maximize the credit that we receive with that presentation. So some of the things that we're going to want to talk about is our program, what it does, the very basics of SHIP. We're going to want to discuss what Medicare is and how we assist people with Medicare. And then we're also going to want to make sure that we cover that we assist with financial assistance and sort of go over a very surface level of all of the things that we do to assist people. That way we can make sure that we are able to count, you know, as many topics as we possibly can. If we were setting up a booth, the same thing goes for the materials that we're bringing and making available at that booth. I would definitely make sure and bring our double-sided rack card with SHIP and SMP. I neglected to mention that. If I was getting up, I would also mention, you know, our partnership with SMP to make sure that people are very aware of all the fraud that goes on within our state. I do believe that everybody would be able to relate about all of the robocalls and scam calls that come through, I would guess, on most people's phones every day. But at that booth, I would make sure and have that double-sided thing, so it would have a little bit about SHIP, a little bit about SMP. Definitely make sure that I brought plenty of personal health care journals, information about Medicare, as many of the red, white, and blue Medicare and You handbooks as possible, since we have not been able to hand those out very much for the last year. And I would make sure definitely to bring all the materials we had on all of our financial assistance programs as well. That way everybody could sort of get all in one right there and be able to look at all of the possible information that we could provide to them, and also to maximize what we can cover and count. So because we've made a point to talk about our assistance with financial programs and what we can do to help people apply for those, or have made those materials available at this event. We're going to go ahead and mark MIPA as well, because we've made sure also that we mentioned S&P and made S&P materials available as well. You know, maybe even a flyer on current scams or you know, what to do when people are trying to scam you. You know, prevent, detect, report in there. We're going to mark S&P as well. The partner organization affiliation, you know, typically stays empty right there, but the session conducted by should be your name if you've got your own login for stars right there. The total time spent in hours, we're going to say that the CMA Fest was nice enough to let us set up and start during the day, and allowed us to keep our booth up and going throughout the night, despite how rowdy Broadway gets. So we ended up getting 8 hours worth of or we'll say 8 hours. It's going to give us a note that, hey, you've entered a time that's greater than 3 hours. Please make sure this is accurate. So we're going to say, yep, we were there for 8 hours, and they did allow us that 15 minutes to come up and present as well. But we're going to just go ahead and just go with the booth for this example right here. So we were at that booth for 8 hours. The title of the interaction is CMA. Here, let me do CMA Fest. I'm going to put test in there just so I know that this is not a real thing. Not that I actually think that any of us have actually had a booth at the CMA Fest, but I would also like to just make sure that that can be easily found so we can get that out of there as well. I'm going to put booth in there too. Yeah, CMA Fest booth. Just so if I was entering it, then anybody in any portion of the state who saw that would be able to tell, oh, okay, it was a booth that Ryan had done at the CMA Fest. Right there, the type of event, you'll see that the 3 things that we talked about that count towards performance measure 2 do pop up, that being a booth or exhibit, an enrollment event, or an interactive presentation to the public. What we're going to do is we're just going to go that this was a booth that we had there. So I'm going to hit booth right there. The number of attendees. Now, the number of attendees at any of our very large fairs that we attend or anything like that will not be the total number of people who have turned up to the fair. It will be the number of people who have come by and interacted with us while we were at the booth. Now, that does not mean that somebody has to come up and have a full-blown conversation with us, but somebody walking by and viewing our table, then we will go with that. Typically, what I try to do is to, when I'm at any sort of event or table, I try to just keep a good general idea of how many people are crossing by my table. Just for example, when I went to when I worked in the Johnson City area, that's over in the 1st Tennessee region as the volunteer coordinator, we would go to the Greene County Fair or the Appalachian. I have to make sure, just in case we have any Northeast Tennessee people, that I mispronounced that. That I would make sure how many people normally came to the fair, and know that, okay, if 3,000 people typically show up to this, then I know that no more than that many people are going to be passing by my table. But for example, if I was going on senior night where, you know, seniors were going to get in free or at a discount, then I would know that possibly there could be more there, but I would just keep a sort of a general running tab of about how many people were coming past my table. Obviously, when we're in a large event like the CMA Fest would be, we could never really have a true count unless, you know, we were literally holding one of those counters and clicking that each time some person came past, but that is too much to ask of any person. So a good general number works just fine there. So I'm going to say that through the time that I was sitting there, that probably, let's just we'll undershoot what it would actually be. I'm going to say 3,000 people walked past my table. Now, it is going to still give me that message that the value that I entered is greater than 999. So it's basically saying, whoa, you're telling us now that you're that 3,000 people attended this. Are you sure about that? It does say this will not prevent you from saving, but they are trying to just notify you if you instead meant 300 but put 3,000. They want to definitely make sure that you're aware that, hey, you're entering a number that is much higher than a typical event would be. So you could know that you were entering that correctly. Now, they do require you to put a start date for that activity. They do not require you to put an end date. For example, I only put a start date on everything. I don't typically end up leaving my materials overnight any place. That's not to say that we have not done that before. It is just not typical for an event that we do. So typically the start date and the end date are the exact same. But for example, if we were to leave when I worked in Johnson City again, we held a conference for a convention of judges that were holding a convention there and doing training. And what happened was that they were running that training from very early in the morning to very late at night. And we're just making that available. So what I did was, because we left that table set up so they could still come by and collect, information, even after we were done, working for the day, I would put the end date of that activity for ending the next day, because we were letting them collect that information for the remainder of the night through into the next day. But for the most part, anytime where you put a start date of the activity, the end date of that activity will go right behind it in the same day. The zip code of the event, wherever the event takes place. So I'm going to put 37243. That's just the zip code that I'm at right now. Obviously, the same rules apply as before. If it has multiple counties, if it was not in fact in the county that you had intended, then you can change that county. If you have a event contact with any of these events, you can put their information in right here. It is not a required field, so you do not have to feel like that if you do not enter that you're doing something incorrect. But I always tried to put whoever my contact person's name and information was, put that on there. So if there is any sort of doubt, like in this case where we're saying that this event lasted for quite a long time and that we saw quite a number of people, then we would have somebody who we could contact who could possibly give us some figures that would go towards lending some truth to our case. I do not believe that there would ever be that much questioning, but never can be too careful. Better safe than sorry. Now, the intended audience at some of these events and presentations, it is certainly dependent on who we're gearing the presentations to, but also, to what population are we presenting to? Obviously, beneficiaries is probably going to occur with any sort of table or presentation or enrollment event that we set up. But if we are going to some sort of, retirement presentation for a company or for a school or something like that, you may put employer-related groups. If you're going to meet with, or people have identified as being family members who are looking for information for their loved ones, or if you're going to a church or a community center or something like that, you may put that. If you're going to some sort of multicultural center, and you have people who, have translators, or if you're going to a pre-Medicare presentation, if somebody has identified that as Medicare planning, then you could possibly mark pre-enrollees. If you're going to one of your partner organizations to give a presentation to them, either for the purposes of training them or for the purposes of just giving a presentation to all of the people that they serve, then you could put that. If you're going to a disabilities coalition, you could mark that. Going to do a presentation in one of your rural counties, you can mark rural beneficiaries. You just have to make sure and mark to what audience you're presenting to and how you've geared that presentation or that booth. Obviously, if I'm going out to one of my rural counties, I'm not going to bring, all of the same sort of materials that I would bring if I was going to, one of my metropolitan areas. If I go to an area where I know that the average person's wealth or income is lower than opposed to another portion of the state, then I'm going to bring more low-income materials than I would about information, just for example, that I would about a health savings account and how a health savings account works with your Medicare. It's all about how you are gearing your presentation or your booth. And the same thing goes with your target beneficiary group, describing, who is attending or who you're seeing at those, as well as how you've geared that presentation goes into what you mark with that target beneficiary group. And then, of course, topics discussed, or to put it in another way, topics made available or materials made available. Any materials or topics that you're discussing at this presentation or making available at this booth, then you're going to be marking that in there as well. If there are any notes that you would like to put regarding that, or if there's a flyer for that event that you would like to save and have in the system, you can most certainly scan that and put that in there as well. But once you do that, you can save, it notified me that I did not put any of these. So what I'm going to do is I'm just going to say low income and that we discussed generalship information right here, just to save that. And you'll see, because I put MIPA information. This person does not have a CSRS ID, so I'm just going to go ahead and take their S&P mark off there. But just know that if you are marked on your profile to do S&P work, you will have a CSRS e-file ID. This person is not active with the program, so that's why they do not have that ID in there at the moment. But once you get all of that entered, you'll see that that reference number appears there, and we know, okay, we're good. We've made sure and got that information in right there. So I can click off and go wherever. But if we go back under the training inbox, you'll see media outreach and education, and we'll do the same thing that we did. Third time's the charm there, new media outreach and education. Now, media outreach and education are all of our outreach that does not count towards our performance measures. These are the things like if we put up a billboard with SHIP information, if we get in contact with every door direct mail and do a mass mail out to people within our community who we've never spoken to or have not contacted us before, or if we do an email blast or a radio commercial, anything like that, a Facebook post. These are the things that you can look at as sort of spreading seed or casting many lines for trying to gain beneficiary contacts. We are getting our name out there into the community, and it is not necessarily counting towards our performance measures, but we're hoping that it will lead to more people contacting us, thusly counting towards our performance measures from how many people will contact us as a result from this. So the same things apply. If we're sending out information that has our low-income assistance information on there, then we're going to mark MIPA. If we were sending out information about fraud and abuse, we would mark yes to S&P as well. The time we spent in hours, I'm going to say that this one is going to be, you can see all of the types of media in here: email, magazine, newsletter, newspaper, radio, social media, television, on our website. I'm going to say that this is going to be a mass email that I'm sending out, that I'm reporting. It is still important to report all of our media outreach into STARS, because if we're making effort towards improving our program and trying to contact more people, even though it does not count towards our performance measures, we still need to report on that, because it is effort that we put forth to our program that we definitely do want to still highlight. So I'm going to say that, you know, I spent some time and effort putting together this email blast. I designed a couple of pages worth of a electronic flyer. I collected information and put this together. So I'd probably say that just in terms of how much time I spent doing this, I spent 1.5 hours working. I don't think I put the decimal point in there. Nope. Okay, yeah, sorry. I can't do a decimal point there. So I spent 1 hour and 30 minutes working on this email blast. So we'll say SHIP April, got to learn how to spell, folks. SHIP April email blast. I sent this to an email group that I had. It consisted of 300 people that have subscribed to that list. It is not for outside of the state of Tennessee. It is only for inside of Tennessee. So I'm going to say that it is going to go statewide. I'll hear there are people from all across the state who are on this. So it's going statewide here. If I was only sending it to counties within a particular region, then of course I would say county or counties if it was only contained to my region. But since I'm sending this out, I'm sending it statewide to everybody. I did complete this and send it out on April the 22nd of 2021. I worked on it here in my office here at 37243 zip code. And I was sending that out to Medicare beneficiaries, their family members, pre-enrollees, and rural beneficiaries. My target group for that was Black or African American, disabled, Hispanic, Latino, low income, and rural. Rural. What I had sent out was low income information for all low income programs for all rural people in a specific region. And I sent them information about SHIP, sent them some information about the Medicare Savings Program, and how it relates to their original Medicare. I also sent them some extra help and LIS information and how it relates to their prescription drug plan. And then I went ahead and sent that out. What I would suggest in that case, if I was sending out an email blast, would be just to save that email blast and to upload it right here. I probably wouldn't save the actual email blast just because it would have everybody's email addresses on them, but I would definitely save what information was sent out to them and put whatever, whatever list I took that from in the notes there, just so we would have that information. And then I would save. And again, the SHIP reference number shows up and we know that everything's all good. So that would be sort of the entering of all of our new contact information for various different contacts that we had, whether that's outreach or one-on-one counseling right there. For many of the coordinators and for some of you who have higher access within your region, you will be able to create team members. You can add additional volunteers to be able to have a STARS profile. For anybody who is on this, who is a new volunteer who does not have one, or maybe an existing volunteer who, wishes to enter their own data and be able to track that information, you can reach out to your volunteer coordinator, and they can absolutely help you get a login information set up, a profile set up for yourself there. But what you would do for anybody who is entering other volunteers here is you would go to tracking inbox, go right down to SHIP team member and hit new SHIP team member. Now, there is some information that is going to be required on here. Some information that we do ask for everybody when we're creating a new SHIP team member profile in STARS is their first name and their last name, their primary phone number. If you do not want to include your primary phone number, in the STARS system, we do ask that you have that information available to your volunteer coordinator, just so in case anything was happening or you found out that something that you had volunteered for was being called off, or if there was any sort of thing that you and the coordinator needed to settle between yourselves, that you would have a contact number in there. But for STARS purposes, we can absolutely put that as either the AAAD that you're volunteering for's number, or you could always set that to 1-877-801-0044, just so we can identify that you're a SHIP volunteer in there as well. And if ACL needed to locate anybody, if they contacted us and said, hey, we're trying to figure out what region, you know, X, Y, and Z volunteers for, then the call center agents could let me know of that inquiry, and I could handle that rather than it having to be sent out across the state and take a longer process to get resolved there. It is also important too to have an email address entered in there as well, especially if you are wanting to get login credentials for your profile as well. What happens with that login we'll go over here, but just know that typically for somebody who I'm setting up who does not have an email address or needs access but cannot access any sort of email address at the moment, then I would enter my email address in and help them get their profile set up. Then once that was done, go in and remove that email address from there, so it is not sending out notifications for this person to my email address anytime. For address and city, those are not required. You know, when in doubt, you can always put the TCAD that you're volunteering for address and city. For zip code, that would be whatever zip code that you usually conduct your volunteering work in, or whatever zip code that you live in. Again, if you don't feel comfortable with that, the zip code of the TCAD also does work as well. The start date, the day that you started volunteering. So for anybody who may be new to the program, you know, now your start date would be, you know, the day that you have, you know, initiated your volunteer work with the program. The end date, that you don't have to worry about that unless we're trying to put an end date on somebody's volunteer work and putting them inactive in the system there. The status of the volunteers there, for anybody new to the program, you will start out active. The other options are inactive or retired. For somebody who retires, we have that so we know that this volunteer is not sort of in limbo. They're not actively pursuing that, and we are not trying to re-engage them, but they've decided, hey, I'm done. I have decided to not volunteer anymore. You would be considered inactive if you have not maintained your volunteer update hours, you've not maintained your certification, or you've not submitted at least one volunteer report to your volunteer coordinator within the past year. You would be considered inactive at that point. The partner organization affiliation, it will show, you know, whatever region you're affiliated with. Again, this person was one of our call center agents, so that appears right there. Paid status, obviously for partner organization affiliation, you would just select the TCAD that you are volunteering with, or if you do not volunteer with if your program is not affiliated with TCAD, then whatever SHIP program you're volunteering with. Paid status, obviously for any of our SHIP staff, that is SHIP paid. In-kind paid, in-kind volunteers are our volunteers who are not SHIP staff. They're not paid by SHIP. However, through the course of their normal work, they are also conducting SHIP volunteer work through the course of their normal work. These are a lot of people like our senior center directors, our information and assistance counselors, our choices counselors, our options counselors, our service coordinators, just to name a few right there. And then volunteer, that is obviously your true volunteer who, you know, is not currently working with another program or is not carrying out those volunteer services just through the course of their normal daily employment. Oh, probably should. probably should put some of this information just so I don't get to the end and have to say, well, I didn't do any of that, y'all. Obviously, with race or ethnicity too, that is not something that you know, is of great importance. But we do like to definitely have our volunteers, you know, marked down for their race or ethnicity, just so we can make sure that we are, you know, employing a diverse volunteer team as well. So for this person, I'm just going to mark that they are Black or African American. Their date of birth, nobody outside of nobody outside of this system, you know, will be able to view everybody's date of birth. So please do put your date of birth in there. We do like to try and send out birthday cards when possible. But if you do feel uncomfortable, or if somebody does not want to give you their date of birth, my response is always to do 01/01/1965, just because 65, the age that you become Medicare eligible. That's just always been my default. If somebody refuses to give me their date of birth, or will, you know, or won't identify for that. Gender, the same thing applies as race. It is not important to us what anybody's race or gender is, but we do like to make sure that we have at least record of a diverse volunteer team. So I'm going to go ahead and mark the test subject as female, like I did last time. Their primary language, whatever that may be. If you put other, you can most certainly do that. We're just going to say that test subject speaks English and does not have a secondary language right there. Role, the role that you have within the program will be dictated off of, or will dictate what access you have. For the vast majority of people who are going to be given access to the STAR system, you're going to be put in as a SHIP team member. What this means is that you're going to be able to enter your information into STARS. Any contacts you have, you're going to be able to enter that in. You're going to be able to search your own information and be able to edit your own contacts, but you're not going to be able to search anyone else's within your region. SHIP site staff do have that ability to search everyone within the region's contacts, but SHIP team members will only be able to find their own. STAR submitters will only be submitting that. They won't have access to go and edit and look through all their contacts. They'll just be submitting those people in. So just for the purposes of doing this, we're going to mark that person as a SHIP team member. And I'm gonna come back to this information right here. It does ask what program they're going to be working for, so we're going to mark them that they're SHIP, SMP, and MIPA. That would make sure that those two questions that are at the top of all of these contacts show up, MIPA and SMP. You would enter their SIRS e-file ID when they have one as well. And then, of course, you can feel free to upload any of that volunteers' information in here as well. You know, their application, any sort of, you know, testing certificates, training hours, anything like that, you can feel free to put in there. I would say that, you know, if you're going to put any information in there, I would just double check with the volunteer and make sure that they feel comfortable with you putting all that information in there before doing that. So what happens, I said right up here that you need to enter an email address in order to send those credentials out. So let's just say that I've entered in this person's email address, excuse me, and what I would do is I would mark send login credentials, and then when I save this, what it would do is it would send them 2 emails to their email account. The first one will be an email notifying them of what their username is going to be. Typically, it is going to be their first name, period, their last name, and then a number after it. The second email would be an email containing their temporary password. And what they would do with that is once they've collected that username and password, then they would go in here, they would enter their username and temporary password, and it would let them in. I'm going to go ahead and just exit out of this really quick. It would let them into this page right there, and then all they would need to do is go to my account password to enter that temporary password one more time, and then set up their new password at that point. Or if you were doing that on behalf of somebody else, then you could absolutely set that up. Ask them, hey, here, hang on. You could ask them, what would you like your password to be, and set that up for them, and then just give them their username and password from that point. But again, you would have all their information entered, hit login credentials, and hit save, and that's what would trigger that at that point to send those emails out with all of that information. If for any reason you felt like later on that volunteer was abusing their power on here, entering in incorrect information or knowingly entering wrong information in, then you could absolutely go right here and hit revoke login. And once you hit save, it would take away their ability to be able to log into their account as well. Thankfully, as of right now, we've not had to revoke anyone's login. Maybe we might have had to revoke a login one time just from a question of a security standpoint, but thankfully that's not going to be very often. It just won't be prevalent when it comes to what most volunteers will typically do. So that would sort of cover entering in all new contacts at that point right there. The next sort of ribbon across here is going to be the search function. Fortunately for everybody, the search function is going to be a little bit shorter of a section that we're going to cover. The next two are actually a little bit shorter of sections. What you can do with these searches is there's quite a few ribbons here. There's my saved searches that will take you up to something, and you'll be able to look at a few of different searches that people from other areas have done. But for the purposes of what we are doing, most of you are not going to really mess around with these first 3 searches. If at all you have the ability to do a search, which most of you will, but what you'll be doing with these searches is going down to the four things that we just covered about how to put new contacts in and doing a search that way. When you hover over each one of those, 2 things will appear: a standard search and an advanced search. Now, the advanced search is going to be where you will go in order to get more specific caveats with your search, and we will go over that. But for the past few years, STARS has been undergoing maintenance and trying to do specific things. the advanced searches has been sort of an ongoing issue for a good while with the STARS system, and it can be spotty at times and not the most reliable function. So I very rarely do any sort of advanced search. I do a standard search for most things. I will show everybody the advanced search as well, but let me just cover the standard search as well. When we look at our standard search here, and let's just say that going off of what I entered before with you know, our test subject here, let's say that person who I sent that comparison to called me back and wanted to discuss the comparison that I sent them. Now I'm going to follow up with that person, so I'm going to need to key in a new contact. Of course, you can go right here and put in a new beneficiary contact, but that is not really the way that we're supposed to do that when it comes to entering our contacts into the system. What we would want to do is find that person and pull up their file again and do an additional session with them. So that's exactly what we will do. And you'll see you can search additional sessions as well too. But what I'm going to do is I'm going to go ahead and click beneficiary contact. So I went to search, did beneficiary contact, did a standard search, and it brought me to here. What I'm going to do is I'm going to check that beneficiary contact box. And then if you go right here and hit remember criteria, that's always a good practice because STARS also will sort of have some thinking issues from time to time and also duck down. And so if you're going through here and putting in a lot of information to narrow down your search, it'll remember everything you've put in. So you can search based off of a good number of things, off of their first name, last name, who the session was conducted by. That's always something that I do whenever I'm on my own profile and I'm looking for somebody who I contacted. You know, I'll just go ahead and hit that and hit conducted by me, and then I can set them alphabetically and look for who I'm looking for. But in this case, because we did somebody with such a unique first name, I'm going to search by name. So if I go down through all these different options, I found beneficiary first name. Now, right next to that, you can see that it says equal to, which means that what I put in here, that's what it's going to search for. So if I don't spell it correctly or if I put characters in there that are not supposed to be in there, it will not find it. We can open that and put not equal to if we're searching for everybody that is not whatever this information is. If it's like that, if it shares a majority of those letters or resembles that, then it would pull that up. Not like, we'll do the opposite of that. Starts with this and ends with this. So you can search by a good variety of things. Now, because I put the person that we entered in before as test subject, then I'm able to just put in test for the first name, and boom, it pulled up that contact, test subject 422. And so what I'll do is I'll click on them. And when I do that, it pulls up exactly what was entered before. And you'll see these two tabs right up top here. You'll see that this other tab says beneficiary additional sessions. So if I click on that, then it brings me to this. You can see there are no additional sessions with this person. So what I'm going to do is I'm going to hit new. And at that point, it brings up this additional session. You'll notice too that the information that requested is not near as much on this one as well, because they've still got all the information from here. So what they're going to ask now is, hey, are you asking them about MIPA again? You know, you can say, yes, we discussed MIPA again just to make sure that they did get their figures right, or no, if you say, no, we didn't discuss it because we discussed it, you know, last time. Who the session is conducted by. These are all the various people at the call center, but I'll just go with whose profile that we're in right here. I'm still contacting from my zip code here. I'm going to say that, yes, it was the same day. They called me back the same day, so it's still 4/22. They called me by phone and then go through the various topics that were discussed again. In minutes, in hours, the time spent on this. If you enroll them, obviously you do want to make sure that enrollment is marked on these. That is a process that we're going through right now, is correcting flagged enrollment contacts. So there are 3 things that if we're doing an enrollment contact that have to be in stars, that would be that enrollment has to be marked on Medicare Advantage or Part D in these topics. There has to be numerical values in the original and new cost outcomes boxes here. That has to be numbers and decimals only. And then there has to be both a comparison and an enrollment confirmation page uploaded in the system there. So yeah, comparison and enrollment confirmation right there. So once those are in there, then we could hit save and do an additional session right there. But the important thing is that you can go and run that search and find the person that you're looking for through that manner. I mean, you can search through just date of contact. You'll be able to look for, yes, it was on this day. I want to find somebody who called me before this date, or I know it was last week, but I don't know what date. You can say after a specific time, between. If you were looking for somebody who, for example, called during the open enrollment period, then you could set it for October the 15th and December the 7th and search through there. But if we go and look at advanced search as well, it is going to be obviously a little bit more information and, will be a bit more confusing for somebody who may not have used the system very much before, but it gives us these tabs up top. The first thing it's going to ask is our search criteria. So are we looking at beneficiary contacts, or are we looking at additional sessions? What sort of, element are we looking for? All that same information that was asked. What do you want to search by, essentially? I'm going to say beneficiary first name, equal to, not equal to, starts with, ends with, is blank, is not blank. That's another good one. If you want to search for somebody that you entered but you never actually put in their information, you could do that as well. I'm going to go ahead and just click equal to and just say that I'm still looking for this person test and add that to the column. So essentially it's saying, okay, we're going to add this as what are we going to search by. In the columns, it's also going to ask, what are some of these other, topics that you're interested in searching for. You want to look at the, what date that contact was, what gender that person was, what county, what method of contact that you spoke to them, how many minutes, zip codes. All of that is in there. What unit do you want to search? For most people on this call, it's just going to solely be your area agency or your SHIP regional organization that's going to show up there. On mine, it shows the entire state of Tennessee and then breaks it down by region, or if you've got specific organizations within your region that you break that down within, that'll be in there as well. But just for the purposes of this one, it's just going to be the TriCore call center there. And then display as. You can, it asks you, how do you want us to show this to you? Obviously, if you put HTML or doc, it's going to appear as one of those files. HTML, it'll just pull up another, tab right here and go into it. With an Excel sheet, what it will do is it will bring up an Excel spreadsheet. You can ask if it's an HTML to display in the same window, in a new window, to display or hide the search summary. Just for the purposes of this, I know that we're running up shorter to the end of our day today. I'm going to just run the Excel really quickly here. And while it's thinking, no, it's not going to think very much at all today. It's one contact is what should show up. So but I didn't add any additional information in here. So it does show that there was one contact that had the beneficiary of the first name as test. Obviously, if I would have added more columns, it would have put all that information out, depending on what I had put in all these searches as well through here. But just in the interest of not going too in depth for our initial training or anything like that, then I won't go through and take up our time with looking at that. But you will see that all the searches are going to look similar to, leave this page, are going to look similar to what we had looked at. Obviously, for the advanced search, that's going to look similar to that. Again, those can be spotty at times, so I would always recommend trying a standard search first to see if you can find what you're looking for. For group outreach and education, you can search by all the same information that we were entering when we were entering those as a new contact to help and find those. For anybody who's entering their data or anything like that, I always find it very easy to do session conducted by, because then you can pull up all of your contacts, and when you've got that search pulled up, you can order those alphabetically or by date or anything like that in order to find those more easily. Here, I'll just for the purposes of demonstrating that, I'll show you that Ms. Carrie Speck, who we're talking, whose profile we're on. If we search hers right here, you can see that this is the 3 people that she has spoken to on the phone and got in the data system here. I can order those by first name alphabetically, by last name, by date of contact to show either the most recent last, or if I click it again, it'll show most recent first, and that will show up on there. So if you do the standard group search, you can search by all those things. I always go by session conducted by as my first line of searching right there. With media outreach, you can search by all the information that we had entered prior. And if we were searching for team members as well, you can just, hit team member, hit search, and it'll pull up all of the people in your region who are volunteers. Or if you go back to that standard search, if you're looking for someone in particular, you can search and try to try to narrow it down by name or anything like that. But if you're within a particular region and you have the access to search other people in your region, if you hit standard search and just search team members, it'll pull up everybody in your region to be able to find somebody. And that is typically how, if I was to do that search and for the volunteer coordinators, if I was trying to give somebody access or take that access away from them, then I would go and search their profile and then go and revoke login if I needed to. Or if somebody got locked out, then go in and hit yes to send login credentials, and they'll be resent their credentials to be able to get logged back in more easily. But of course, all of the coordinators do a very good job of if somebody gets locked out or they get locked out, of sending that to us, and we can very easily help somebody get back in as well. So that's how you can search all the contacts that you've entered or anyone in your region has entered if you've got that access. For reporting, we covered that. These are all various reports that have been run throughout the region, or at least it shows that on mine. It may not show that option on there. If you've saved any of your advanced searches, they would show up in here as well. But reporting is not where we go to actually run our reports. Configuration is where you will go if you want to run any sort of report for our performance or anything like that. So if we just go right over on this ribbon to configuration, go down to pages and click on shared pages, it brings us up a list of various different reports that we can run in the STARS system. Obviously, the two that are going to be the most important, in my humble opinion, is going to be your SHIP performance measure reports and your MIPA performance measure reports. What is going to happen is that depending on what your access is, and of course, the access of Ms. Carrie Speck here is site manager, so she's able to view everyone in her region who has entered anything into STARS. She'll be able to see more. If you are of lower access within the STARS system, you may not have all of these reports that show up, or if you do have those reports, it may only show what you individually have done when you run these reports. But I do just kind of want to show really quickly the kind of report that can be run so everybody can be familiar with sort of the capability of what we do. So what I did was I went ahead and just clicked on the SHIP performance measure reports. That's our SHIP performance measures that Lori went over earlier, that being performance measure 1, total client contacts, performance measure 2, outreach contacts, performance measure 3, under 65 and disabled, performance measure 4, hard to reach, that's your limited English proficiency, your LIS, and your rural contacts. And then performance measure 5 is your enrollment contacts. It was those 18 topics that count towards that in performance measure 5. So right here with mine, obviously I can search the entire state as well as Lori and Alanka can. So of course, we're always happy to run that report and give everybody how we're performing as a state at any time. But you'll be able to run the report for how your region is doing. Again, this is a TriCore agent, so we're going to put that in there, and we'll go ahead and just look at our performance for the past year. So for anybody who is unaware, our grant year runs from April the 1st through March the 31st of each year. That's kind of our SHIP year goes from April through March of each year. So that's sort of the time frame that we look at most. So after I run that and enter that in, it'll think about it, and then it'll generate a little pop-up right here and ask me if I want to open it or save it. I'm just going to open it for everybody. And you'll be able to see TriCore's performance numbers. It will show what the current date range that was, we asked for April the 1st of 2020 to March the 31st of 2021. You will see that for that time period this year, they were able to reach a total of 16,935 contacts. Now, the call center is different, because they are sort of the first line of defense. They rely on people calling in to the hotline to get those contacts. So this is solely people who are calling in to them. So you will see that the number of calls that came in last year, or I should say from April the 1st of 2019 to March the 31st of 2020 were a little bit higher. There were about 10,000 contacts higher than they were on this past year. Of course, everybody will be very aware that this past year we had the pandemic sort of hit right before this period ended. We were able to reach nearly as much as the year before. We went down by about 10,000 contacts. So it does show right here that's about the appropriate loss of contacts that we would have expected within the last year. But you can see that we can look at not only our performance measure one, not only our total client contacts, but we can see what our performance is on all 5 performance measures by running this report. The same thing applies when running the MIPA report. It will show from the time period that we run, how we did the year previous with that as well. Whoops, sorry, y'all. The data export reports will enable us to be able to run data reports on very specific things. That will be our total client contacts, total additional sessions, those same additional sessions or beneficiary contacts that have to do with our MIPA topics, and then the same thing, those contacts and additional sessions that have to do with SMP. The Part D enrollment outcome reports, that is what I was talking about earlier with us being under the process of correcting flagged enrollment contacts. That's not something that we'll get very deep into at the moment, because we all as a program are doing more training on that and making sure that we're giving ACL specifically what they're looking for on these. But you could probably expect to see training on this within the next 6 to 8 months, maybe even at our volunteer conference that will take place later this year. We'll have a session on that. The resource report we'll do as the last thing, but our STAR summary reports, this one is just going to launch reports on very specific things that we're looking for in the STAR system. So a report for, for just the partner organization affiliation. If we're looking for a summary report on just one person, we can go and look at just individually how many contacts did you do rather than looking at the entire region. And then the resource report right here is more of just trying to get a breakdown of our diverse workforce within our state. It will show you things like how many hours were participated in through a certain period, the age of our teams, what the race and gender breakdown is. Hang on, it popped up on my other screen here, apologize. So you'll see that out of the 10 people within this time period who have been involved with our call center, you can see that about 4,817.98 hours have been totaled with that throughout those 10 people. They were all ship paid staff. They are call center agents. You can see that there is one person out of those who has been with SHIP for less than 1 year. There were 7 who have been there from 1 to 3 years, and there have been 2 who've been there for more than 3 years. There are 8 of those 10 are below the age of 65, 2 are above. All of those call center agents are female. There is 1 who is Black or African American, 8 white, and 1 is not collected or preferred not to say. And then they all speak English as their primary and sole language. So you can look on there and collect some information to at least that is at least very important for that. Now, I have not checked the chat through this process, but Lori or Alanka, are there any questions about the excuse me, the STARS system that I can answer?
No, we had an issue with Christine's name not populating. I'm hoping I fixed it for her. So if she will check that for me, I will be graciously waiting for that response. But there was a request that Booz Allen adds an SMP button on additional session pages. That would be nice, but that is not up to us. And then there was a question on if we are going to be taking, they're going to be taking the test today. So that is going to be sent, as far as I know. Alanka, do you want to answer that?
Well, let me answer the first part of that, and then let me turn it over to Alanka, because Lori's right. Alanka will be the person to let us know when the links will be sent out. With Booz Allen, we can make requests. I'm going to write this down. I'm going to put that on here to put an SMP button on our additional sessions. Full disclosure with Booz Allen is that they want very specific things for that data system at the moment, something to make that data system more useful for their needs. So, like I said, they've been working on those advanced searches for a number of months, and it still is not really resolved yet. So, I'm going to be putting in requests with Booz Allen continuing, excuse me, for things like that, for more specific categories on the volunteer activity forms, and for various number of things. We have had requests of adding additional races or selections for gender or things like that. But to just be very polite to everybody, I would not expect for something that would be sort of that, for lack of a better term, minute in ACL's eyes, to be something that would be a higher priority. But I'm hoping to continue adding on to the list and just keep hounding, for lack of a better term, Booz Allen to make some of these corrections, because yes, I do understand, it's not lost on me that this system ultimately goes towards being something that they can use. But first and foremost, it is a system that we use every day consistently. And I feel that if we are not happy with it and it is not the most effective for us, then that will speed up and it will not end up being extremely successful for them as well. So yes, I will definitely put that down and make that request. And then for the testing, Alanka, I'll let you take over on that one.
Okay, hey everyone. So for the test, my original plan was to send out the online exams to everyone so they could take them at their convenience. However, just for convenience sake, or if you're unsure of what level test you can take, what I'm probably still going to do is just send out the exam to everyone, all 3 levels. If you're aware of what level exam you need to take, go ahead and take that exam. You're only required to take 1 exam. You don't need to take all 3 if you are a level 3 volunteer or anything. But if you're unsure of what level you need to, what level exam you need to take, I would ask your volunteer coordinator. I know South Central, Mike is going to be administering the exam today for the volunteers, but otherwise, you'll have the ability to take it online today. Yeah, that is that. I have everyone, for the most part, accounted for, so everyone will get the link to that. As soon as we're done with this, I'll just go ahead and send it out. And then we should have the links for the recordings, hopefully tomorrow. And I'll send out a couple more pieces of information from our training this week. But does anyone have any questions about today? And I have your emails also if you registered online.
I will go ahead and point out too, because we're recording this for the purposes of YouTube. If you are watching this on YouTube after the fact of the recording of it, which is April the 22nd, please do reach out to your volunteer coordinator in order to receive the links for that test and to be able to take that test, whether that is electronic or through a paper copy. Please do reach out to your volunteer coordinator right there. We do have the expectation that from the date that you have received your training, that you have a week to submit that testing.
Exactly. So a week from today. So by Wednesday of next week for those who are
or I
watching.
should say from once you've received your test. That's probably what. Yeah.
We'll go from there. All right. Does anyone have any questions about our training today, or we might want to turn the recording off?
Yeah, unless anybody has any further questions that they feel like would be very beneficial for somebody who may be watching this and is not participating today, I'll give a few seconds for anybody to either type out that they have something to add or type out their questions. But if not, I'm going to go ahead and stop the recording here.